Good afternoon, everyone. Welcome to the White House. Thank you for traveling all across the country to be a part of this important national dialogue. My name is Doug Holscher, and I'm the director of the White House Office of Intergovernmental Affairs. We work closely with the Office of Public Liaison, the Vice President's Office, as well as the Domestic Policy Council team to help convene today's discussion. And we really appreciate you being a part and sharing your perspective as educators, administrators in the K-12 system, also in the higher ed space, as parents and teachers, and we even have some students here as well. And so we appreciate that, because that's what this is all about, is putting the students first and making sure we have a holistic perspective and an important dialogue on safely reopening America's schools to respect the holistic health of students, but also their learning needs as well. And so we appreciate you being a part of the discussion today. I want to just quickly run through the, we're going to start here in the stateroom, a beautiful setting for an important discussion. And we're going to have three different panels. You're first going to hear, though, from a special guest, the Second Lady, and I'll introduce her in a second. And then Dr. Burks will lead a panel with the two secretaries. We'll have a panel on the health, the ABCs of safely reopening schools. And then we'll have a panel on those who are going to have to implement this and do it safely to, again, look out for the students and their health and their learning objectives. And so it's my honor to introduce the Second Lady of the United States. She's a 25-year teacher. She's somebody who is passionate about mental health of America's children and has done several projects and programs and been recognized for her work in that space. Please help me in welcoming Second Lady Pence.
Thank you. I have to lower this a little bit. Thank you, Doug. You know, it's my honor to welcome all of you to the White House today for today's summit on safely reopening our nation's schools. And I have a bias here, so I'm putting that out there right from the beginning. But it's so great to see so many education leaders here who are working on plans to get our kids back to the classrooms and our college campuses, but in a safe and responsible way. We all know we've faced some very challenging times these past several months, but today we are encouraged. Americans have made great sacrifices to slow the spread. Healthcare workers have demonstrated incredible dedication, and American businesses have stepped up. And every state in this country now is open. Parents have been the unsung heroes in this pandemic. I am so proud of the mothers and fathers who wore multiple hats and took on the enormous role of educating their children during this pandemic. And I'm really proud of the kids who were patient with their parents. You know, I've heard many stories, though, from parents who shared their struggles with me. This was not an easy time for parents. They had to become teachers and tutors overnight, and a lot of them were still working from home, sharing the computer with their children. And I know you all in this room, you understand better than most that our children made a lot of sacrifices during the past 3 or 4 months. They gave up playing sports, participating in other extracurricular activities. They missed out on field trips, prom, sharing moments with their friends. Most students had to say goodbye to their classmates virtually because we all thought we would be back. And they had to receive their diplomas in the mail instead of a graduation ceremony. We had a graduation ceremony at our house with just 4 of us for our daughter. So now, as the country reopens, many parents are returning to their offices to work. But if schools remain closed in the fall, We know this decision will have a tremendous impact on families. Sally Goza, where are you? We're so glad that you're here today. Sally is the president of the American Academy of Pediatrics. Thank you so much for your leadership on this. You are playing such a key role. But they released a statement, and I'm going to read your statement, Sally. The American Academy of Pediatrics strongly advocates that all policy consideration for the coming school year should start with a goal of having students physically present in school. As a teacher in an elementary school, I understand the benefits of having the students back in the classroom, but I will tell you, my school, we are changing a lot of things in the way we're going to do them in the fall. I was on a conference call this morning talking about students having their own art supplies this year. We're not sharing like we normally do. I'm not going to be teaching from my art room this year. I'm going to be going class to class. There are a lot of things we can do to make our schools safe. We know the value of in-person learning. It's well documented, and there's evidence of the negative impacts on children because of school closures this past spring. We don't want our children to fall behind academically, and returning to the classrooms will help our students get back on track academically. But in addition to achieving well academically, we know that schools offer our children an opportunity to strengthen their social skills. And research shows that lengthy time away from school can impact a student's mental and emotional well-being. And for me, being away from my students has affected me that way. I miss my kids. I miss them. So as we continue the conversation about reopening our country, we must not leave out our schools. Thank you so much to all of you for being here, and thank you for your strong leadership on this important issue. I'm actually headed to another event right now, so I won't be staying with you. We're launching today a public health campaign for our veterans. It's called REACH, and the president asked me to be the lead ambassador for PREVENTS about 4 months ago, which is the president's roadmap to empower veterans to end a national tragedy of suicide. We need to take care of our vets, but we need to take care of our kids. And right now is the time to recognize that we want to prevent these emotional, mental health challenges that our kids will face if they don't get back into school. So now I'd like to invite Secretary Alex Azar, Secretary Betsy DeVos, and Ambassador Deborah Birx to the front of the room to begin the first panel. And I look forward to seeing you all this afternoon at 3 o'clock. Thank you so much.
Thank you, Mrs. Pence. Thank you all for coming today. I just want to open by really thanking those who have been helping me from the very beginning. The president and vice president very early on recognized the trauma this was having to our children and asked me immediately to check in weekly with the American Academy of Pediatrics and the American College of Obstetrics and Gynecology, really to ensure that babies were born healthy, and then the American Academy of Pediatrics raising their concerns that we could take back to the task force. And I want to thank you for all those early morning calls where many people, I don't know what time zone they were in, but they were early for me, so they may have been very early for them. And I think from the very beginning, they wanted to raise the awareness of the whole child, where COVID-19 was one part of the analysis, but not the complete analysis, where we would look past the one dimension of COVID and public health to the multidimensional lives of children and their families for emotional, physical, and really comprehensive health that really occurs oftentimes within the setting of our school systems. So it's really my pleasure to have Secretary Azar and Secretary DeVos, who through this entire stress of the last 5 or 6 months have been focused on this particular area. So I want to give them a moment to give their opening comments, and then I have some questions for them that hopefully also reflect the questions that you have for them. Secretary Azar.
Great. Well, thank you very much, Ambassador Birx. So thanks to what Ambassador Birx, President Trump, Vice President Pence have done over the last 6 months through this historic response to this unprecedented pandemic, we have the tools to get back to work, back to school, and back to healthcare. So we're talking about the middle one today, which is we can get back to school. We can do so safely if we all think smart, if we accept our individual responsibility and our collective responsibility to act within a smart framework. And the Second Lady actually talked about a couple of the things that we can do to be back at school safely. And I'll talk first K through 12, because we've put out CDC guidance that can be of assistance to our states and our local leaders in reopening. And along those lines, I want to emphasize something the Vice President said to our nation's governors just a couple minutes ago, emphasizing a point that Dr. Redfield, our CDC director, made. Our CDC guidance is guidance. When it comes to reopening our schools, nobody should hide behind CDC's guidance as a way to not reopen schools. Our guidance is to enable and empower the reopening of schools and physical attendance by our kids. So as you think about K through 12, though, just think about the core elements of the Surgeon General's prescription for health care. First, what's your individual circumstance? Are you or a family member someone you live with particularly vulnerable at risk, and take appropriate action accordingly? Second, what's going on in your community? Are you in a community that has large-scale spreading of disease, or is it relatively isolated? Third, what's the type of activity that you're contemplating? And so is the school activities. How do you think through that? And then there are 3 core things that everybody should be doing. First, social distance. Maintain appropriate distance among the kids and with staff and faculty. Second, wear facial coverings when you can't appropriately social distance. Of course, we're socially distanced here. We've all been tested. It's a very different circumstance than our normal lives. But wear facial covering when you can't social distance. And frankly, in a school setting or anything crowded like going to a grocery store, wear facial covering because you're not going to be able to ensure social distance in that setting. Third, practice good personal hygiene. I know it's tough with kids, but it'll be a good lesson. And if you do those 3 things, then it's just smart practice. So setting up the desks in the classroom in a way that has appropriate social distance. As the Second Lady said, have the teachers rotate rather than the kids. Avoid congregate settings like auditoriums, assemblies, cafeterias. Have individual meals brought into the kids, stagger classes, what have you, to just avoid those collections. It's not going to be the full experience. It's not going to be the recess experience that's also really vital to kids, but it's something, it's physical, and as the American Academy of Pediatrics has said, there's an emotional, mental health, physical, and intellectual development toll that happens from our kids not being back at school. And then as we think about colleges and universities, we have to get them back up and running again. And there are ways that you can do that, the same types of tactics there. And I encourage our university leaders, I've got a kid in college, so I get to see both high school and college right now. Think about unintended consequences also. And this isn't the health secretary or CDC making an official recommendation, but I see a lot of universities talking about restricting the number of kids that can be on campus. Okay, well, that might make sense from a social distancing perspective, but do think about the other side of the coin, which is if those kids are just going to be getting houses or apartments in the same school community and, quote, distance learning instead of showing up in class, but then doing all the socializing and interacting without social distance and without facial coverings that you, the university administrators, now don't have control over because they're off campus, be thinking through those dimensions. You see a lot of unintended consequences from very well-meaning actions, and plans. We've got a lot of tools that we've built, testing, surveillance tools that you can use to get reopened, to keep kids, keep faculty, keep staff safe. But we must reopen. We've got to get people back to work, back to school, back to health care, because we can't stay locked in our homes forever. It's bad for our physical and mental and emotional health, us as adults, as well as for our kids. So thank you, Ambassador.
Thank you, Mr. Secretary. Madam Secretary DeVos.
Thank you so much, Dr. Burks and Secretary Azar, and thank you both for your continued solid leadership on the task force as we have navigated these last few months. I'm really honored to be here with so many school leaders who have been thinking and planning today for how to ensure students can be back in school in the fall, and especially appreciative of Secretary Azar's comments about thinking practically about the implications of not having students back together in a learning environment. Our expectation should be that they will be. And there has been a lot of guidance written, a lot of practical thought given to how this can happen, acknowledging that every state and many regions within states are different and have different circumstances and may require different solutions. But I am constantly amazed and gratified by the ingenuity and creativity that the American people show when faced with a difficult situation. And we know today that there were too many kids who didn't have the opportunity to continue learning these past several months. I've spoken with every state school leader at least once, most of them more than once, and they said within their state there were a number of districts that learned how to do it well and pivoted quickly to a distance learning environment, and there were others who frankly just gave up and didn't expect anything, and that's just not an acceptable solution going forward. So when we talk about schools being fully operational and fully functional again in the fall, we can also acknowledge that in some places where there might be a flare-up, it might look different for a period of time. And we can, that would be okay. We can plan for that. But our expectation should be that students can be back together in the fall, whether it's on K-12 campuses or in higher ed environments as well. And I want to especially thank again the American Academy of Pediatrics also for their thoughtful approach to this, because we know that for so many students, the school environment is the best place for them to be, and they have got to continue to develop themselves and not go through another several months to a year of really sort of biding time. So I'm looking forward to our conversation today about how we go with the expectation of students continuing their learning, and looking forward to all of the expertise here in this room. I also want to just give a little shout out to the State Commissioner Richard Corcoran in Florida, who just released a plan yesterday, which is very comprehensive in nature, and there may be other states and other communities that want to look at that, but again, with the expectation that students are together and that families will be able to count on a 5-day school week if that's the right answer for them. So looking forward to our conversation. Thank you, Dr. Burks.
Great. I'm going to ask the secretaries some questions. I just have to stop for a minute and recognize I have two incredible daughters who have been home with 2 grandchildren, and they have what I think sometimes we underestimate children's ability to adapt and understand the situation when they go back to school. Because I was struck by you saying they may not know the hand washing and the personal hygiene. My 2.5-year-old knows pandemics now and germs and how germs are transmitted, and knows the importance now of washing our hands, which we would have never spent any time on before. We just would have ignored that whole thing about hand washing. But the other thing that she's adapted to is the fact that grandma and grandpa can come over, wear masks, be 6 feet apart, and she knows that she cannot invade each other's space. And I think they can learn that also about each other out of respect for each other. Even 5-year-olds of a 2.5-year-old can understand this. So it's amazing how they can follow rules when they're repeated. And I know every parent has been spending the last 4 months repeating that to their children in preparation for them to go back to school about what this really means. So, Mr. Secretary, you have amazing operating divisions that are able to look at all aspects of children, from mental health to physical health to intellectual health to development. Can you share your concerns based on all of that information coming into you about the benefits of being in school versus being in home for the child?
Yeah, and I don't want to preempt everything. I know Dr. Ellie McCants-Katz, who's our administrator of SAMHSA, the Substance Abuse Mental Health Services Agency, will be on the next panel. But schools are important and critical, not just for educating. They are actually the center of so many children's entire healthcare, mental health, social life. A great deal of nutritional support occurs in our schools. A great deal of our mental health counseling and support occurs in our schools. Most of our mandatory reporting for sex abuse or other types of on-child crime occurs in the school-based setting. And we lose all of that when they're not physically together in the school setting. So it's not just about the reading, writing, and arithmetic type learning. It's also the entire network that we have built around our children and the support system for them that exists only in that physical learning environment. And I'm sure Dr. McCants-Katz will talk in greater detail about some of the data that we have supporting how critical that setting is for kids.
Thank you, Mr. Secretary. I know that's what the Academy of Pediatrics brought to me at the very beginning, that both the telehealth, which we fought for pediatrics to be a part of, but also the fact how much the pediatrician and the school teacher all work together to really support the whole child, and how concerned the American Academy of Pediatrics was on the mental and emotional health of our children that may be in more vulnerable situations. And I think in the rush to just close things down, everything was not completely considered in that moment about how we were going to protect our children. I know, Secretary DeVos, you've been working with school system after school system to really work on these best practices on how to keep learning going. And these would be the practices that a school for a short period of time could default to in a moment of a week or two if there was an outbreak. Could you talk a little bit about what you've seen about really what creativity people have brought to this?
Certainly. There were many schools and many districts that did an awesome job of pivoting from in-person learning to distance learning this spring. I'd like to highlight just a couple of them that I'm aware of. I'm sure there are many others, but in New York City, Success Academy, a chain of charter schools that serves tens of thousands of students, mostly vulnerable students, frankly, in their school population. And within a week, they had shifted to distance online learning, and without really missing a beat at all. And it stood in stark contrast to some of their neighbors. A very good model for others to look at. Miami-Dade County, a large and diverse county. Many of you here in this room very familiar with the demographics and geography there. Miami-Dade had a really solid instructional support system that allowed for them to move to a virtual distance learning model, and had extra interventional supports for those who needed that extra boost. Another very good model for folks to look at. The International Leadership Academy in Texas, they took the attitude that learning and instruction must continue no matter what the circumstances are. And they made a really impressive shift again to the distance learning opportunity. A couple of examples closer to home here to Washington. There's a couple of suburban districts here that didn't do a very good job, frankly, and I've heard firsthand from a lot of folks whose children are in those systems how disappointed they were with really the lack of effort and the lack of competence and focus around getting helping students to continue in a distance environment. And then there is another one here in suburban DC who is offering learning through summer sessions to all of their students this summer. So a very uneven application, but all that to say, again, our expectation should be that students, no matter whether they're hopefully in person, and that should be absolutely the goal, for students to be able to be in person in school, but if whatever the circumstances dictate, require some distance for a while, if there's a flare-up of the virus in that particular school or in that classroom, that there are plans in place to be able to shift to immediately, and that can be done seamlessly. I've also heard of a lot of very creative thinking going into how to minimize the risk of students being together in the fall, and thinking about things like, where do you have choir and where do you have band? And I have heard a lot of discussion about thinking anew about learning outside as long as the weather is good, and putting up little temporary coverings or tents to be able to hold your choir classes or your band classes outdoors where you have a lot more fresh air. And I know the medical folks among us would probably say that's a good idea. But thinking about those sorts of situations in ways that are unique to your particular school or your particular community is an imperative for all of us.
Thank you. That was so well said. And I think part of the reason for this dialogue today was to really look past and within the first dimension of where we exist in COVID-19, but to bring together those other dimensions, not only the physical, specific health around COVID-19, but the emotional and mental, intellectual health. And I think, Mr. Secretary, you talked about that at the beginning, and we have brilliant people here sharing with us, and we'll be in that third panel. But how are you tackling kind of the risk-benefit relationships of all of these different factors? And is there a way that we can bring not only a whole of government, but a whole of thought process on the three dimensions of a child and what they need, rather than the unidimensional piece of COVID-19? And how are you thinking about that?
Well, and I think we see this not just in the school context with kids, but just generally as we talked about work or healthcare. In the healthcare setting, I've been trying to make it clear that too often we're talking about health versus reopening the economy. It's a balance between, are we going to have economic activity and healthcare, where I actually think it's health versus health. And so we're seeing kids not getting pediatric vaccinations. Millions of children are not getting pediatric vaccinations. People are not getting preventive screenings. They're not getting diagnosed for cancer. Hundreds of thousands of people are not getting diagnosed with cancer. People are literally not presenting in emergency rooms with stroke and heart attack. They didn't stop having strokes and heart attack. They're not presenting in the ER, where time is muscle and time is brain, and they need to get in. And the long-term, very real health consequences for adults and children of being locked down in your home are going to be with us for some time. And then you add the mental health issues for the kids. Children are social beings. We're all social beings, and we need to have that interaction. And we already have enough of denial of that through social media and everything else, and then we take away the physical side of it at school and those fora. And I think any one of us in this room can see in our own children the impact it has on them. In some respects, we're lucky being essential and having to go to work. We don't actually get to and have to feel all of that personally. That experience. It's important that we deal with the disease. Dr. Birx can talk more about, why we did the initial slow the spread. But that was because of a need to flatten and delay the curve of disease while we built up tools, health system, personal protective equipment, advanced on therapeutics and vaccines, learned how to deal with this disease. But now we have tools where we can manage through if we act responsibly. Acting responsibly, by the way, does not mean going to a very, very crowded bar in an outbreak area without facial covering. That would not be good individual responsibility. If we act with good individual responsibility, protecting ourselves, protecting those in our households, and protecting those that we interact with in just a normal society, there's no reason we can't do any of this. We have healthcare settings. We have healthcare workers. They don't get infected because they take appropriate precautions. They engage in social distancing. They wear facial covering. They use good personal hygiene. This can work. You can do all of this. There's no reason schools have to be in any way any different from the rest of what we need to do on opening ourselves up.
I think you made some just really terrific points. And you know what, I'm sure you all feel this, that what's happening today with our outbreaks across the South, where they didn't really experience March and April in the same way the Northeast did, the Mid-Atlantic, and the Midwest. Yet their case fatality rates are very different than they were in March and April. And I think that's because of what you just described. It gave hospitals and clinicians the ability to learn how to do better care, and critically, how to bring better therapeutics early on into the disease. And we've learned about the spectrum of disease, which frankly we didn't know when this started. All the data said about 17% were asymptomatic. We now know it's way over 50% for people under 30. And that means that they don't have any symptoms. And as we work through this and we get some antibody levels, we'll see precisely by age group who really has been exposed with no symptoms at all, and who we have to really worry about in a very clear way. And that allows us then to focus our resources on protecting those vulnerable teachers, those vulnerable administrators, while we continue to have children in school. And I know, Secretary DeVos, you've really thought about the importance of the in-school experience. And just as our last answer, if you could talk a little bit about why you personally believe it's so important for children to be in school, and why we're holding this today to really emphasize that point.
Well, thanks, Dr. Burks. I think both you and Secretary Azar have articulated some of the important reasons, but as you've noted, children are social beings. We're all social beings, and not being able to be together with students of similar age groups and with friends over extended periods of times, it's unhealthy for anyone. And we've noted the fact that with everything in life, there is some level of risk. And it's a matter of assessing those risks and taking all the different factors into account. So not only physical health and safety, but also socio-emotional health and mental health, and also the opportunity that a school environment provides for all students, particularly the most vulnerable students and students with disabilities who really need to be in classroom settings, many of them, in order to continue to develop themselves as a person. And so it can't overstate the importance of the need for schools to be open again, and for students to have that opportunity to learn together in person. And I would just encourage all those involved with those discussions to listen to the parents and listen to what their experiences have been, and work together to find the right solution for your community and your schools, because it is imperative that students continue to learn.
Maybe you both could quickly, as our very concluding piece, what should really parents expect in all this? Because we haven't really talked about that. So Secretary Azar, what should parents expect and hold the counties accountable for, since it's their tax dollars that are going to support the schools? What should they expect schools to do for them? And then Secretary DeVos, same question.
Well, I think they should expect that the schools can deliver a safe learning environment for their kids, even when we're experiencing a pandemic of this sort. And that means taking the reasonable and appropriate precautions in the school to protect children, to have appropriate surveillance systems, and appropriate social distancing, facial covering policies, enforcement of these, and good personal hygiene. And I don't think that's too much to expect. It's actually fairly basic, common sense. All of this is very common sense if we just will live up to it. It doesn't have to be extreme. We can take a very reasonable course here, a balanced course, and that's what parents ought to expect, because those parents have to get back to the factory. They've got to get back to the job site. They've got to get back to the office, and part of that is their kids, knowing their kids are taken care of.
Secretary DeVos? Well, I don't think I could express it any better than Secretary Azar has. I think that that's exactly what parents should expect. I also think, I would just add that I think that adults demonstrating grit and determination and resilience is an important factor here, and it's important for kids to see, it's important for students to learn.
Thank you. If you could just join me in thanking this wonderful panel. It's a privilege to be here with all of you. And we're ready for the next panel.
Thank you very much, Dr. Burks, for hosting us on this panel. And I'm now pleased to invite the next panel to come up. We have got Dr. Eleanor McCants-Katz, who is our administrator from the Substance Abuse and Mental Health Services Agency at HHS, our first ever psychiatrist to hold that role. We have Dr. Robert Redfield, the director of the Centers for Disease Control and Prevention, also at HHS, and Dr. Sally Goza, the president of the American Academy of Pediatrics, who you heard referred to before, and Dr. Lisa Piercy, our commissioner of the Tennessee Department of Health. We're also delighted to welcome our good friend Governor Mike Parson, the governor of Missouri, who's here going to be participating with us today during these sessions. So Governor, thank you and welcome, and Doctor, I'll transfer that to you. Thank you.
Good afternoon to everyone, and I'm pleased to be moderating this very distinguished panel. Before I introduce today's speakers, I'd like to take a few minutes to share some thoughts on the very critical topic of the reopening of our nation's schools. As the Assistant Secretary for Mental Health and Substance Use, I feel very strongly about the need to protect and promote the mental health of all Americans. However, I take particularly seriously the role of my agency and its work with respect to children. Perhaps never was there a time when this is more important than it is right now. The existence of a physical health crisis does not eliminate the need to address our citizens' mental health. Unfortunately, it actually only makes that need even greater. I lead the Substance Abuse and Mental Health Services Administration, or SAMHSA, which is the only federal agency whose primary charge is addressing mental and substance use disorders across the country. Where better to start in addressing these challenges than with our nation's young people? Protecting and also fostering the social and emotional well-being of children is critical not only to their own development, but also to the development of healthy families, communities, and a healthy and productive society. These children represent our nation's future, and the importance of that cannot be overstated. The work that schools and school personnel do daily is valuable beyond any words I can deliver. Our children spend most of their waking hours in your schools, in the care of your teachers, your administrators, your school personnel. Schools provide education, but also provide an important environment for social development, provide enhanced services for children with special needs, provide essential nutrition, and for many, provide health and mental health services. It is that school that provides children a safe place. Schools which have implemented positive behavioral environments have had exponential success with students. It is the school day, the school building, the school routine that provides kids with structure that is so desperately needed for their emotional development, their mental and their physical health. As we all know, in response to COVID-19, most schools throughout the country suspended in-person classes for the 2019-2020 school year. As reopening plans are considered for the fall, I understand the anxiety and, for some, the fear that this engenders. but I urge all to remember what drew them to an interest in being part of the educational system for our children, no matter the perspective you represent here today. For most, if not all of you, I'm certain it was a desire to shape the future of our young people, to provide them with knowledge and skills and training that would serve them their entire lives. Many of you have dedicated yourselves to that honorable cause. The role that schools play is integral to the healthy growth and development of children. The existence of coronavirus has not changed this integral role. Children need to interact with other children their age. They need to learn how to share, how to play, how to deal with conflicts, how to negotiate, how to persevere during difficult social situations. These lessons cannot be taught online. We must return our children back to the environments in which they thrive. I've kept in close contact with communities during this time, and I've heard that even for children in the safest of homes, with the ablest of parents of sufficient means, the one wish children have is that coronavirus will go away so life can get back to normal. If these are the musings of small children in safe and stable homes, I can only imagine what children who are not so lucky are thinking. One of the most disturbing things I recently heard was that New York City has had a 51% decrease in reports of child abuse and neglect. The knowledge that this 51% decrease in reporting was likely in no way accompanied by a 51% decrease in actual child abuse and neglect saddens me greatly. The role that educators, administrators, school counselors, and other school personnel serve as reporters and as an extra set of eyes and ears looking out for the well-being of our children is absolutely critical. With the closure of schools, we have removed that safety net for millions of children across our country. We cannot simply focus on virus containment at the expense of everything else. We must also remember that, thankfully, this virus does not appear to have a major impact on young people. The data tell us the vast majority of those that will have serious consequences from COVID-19 are over age 65. In no way am I diminishing the tragedies that have befallen some children or the severity of illness on our nation's elderly, but we must take into account these facts as we consider the consequences of not opening our schools. As you think through plans for the upcoming school year, please remember all aspects of health. Never has it been more critical to protect and promote mental health. Think about the effects of these past 3 months on yourselves as adults. It has caused all of us great fear, anxiety, stress, disruption to our routines, frustration, and often confusion. And we're adults with coping skills and tools to address these reactions. How are our children supposed to do this? The best we can do to answer that question is return them back to a familiar environment, a familiar social situation, the comfort and warmth of their teachers, their peers, and their school, the classroom that provides them both book and life knowledge. We've learned a lot about mitigation strategies like hygiene and social distancing, and how to implement these approaches to maintain safe environments. I understand these decisions are not easy. Again, the fear is also understandable. But let's not let our own fears hinder our children's ability to learn and grow and thrive. I, for one, am certain the education you provide, the environment schools create, and the skills they instill are indeed essential services that should be open and available to our country's young people. I recognize that many are considering the cost, non-monetary that is, of reopening, but we must also ask ourselves the cost of not doing so. In my opinion, that cost falls on our nation's young people, and it is simply a cost too great to bear. Thank you for the opportunity to share my thoughts. We have an excellent panel here for you today, and I know you will be very interested in hearing their thoughts as well. What I'm going to do is to introduce all three panelists first, and then I will ask each to begin by sharing their thoughts on school reopening. And I will start with Dr. Sally Goza, who is the president of the American Academy of Pediatrics. Dr. Goza is a general pediatrician and has had the privilege of taking care of children in her hometown of Fayetteville, Georgia, for over 30 years. She is a managing partner in First Georgia Physicians Group. She has been involved with the American Academy of Pediatrics Georgia chapter for over 20 years, including serving on the board of directors, Medicaid task force, and as chapter president. She is currently on the Legislative Committee, the Fall Planning Group, and the Board of Pediatric Foundation of Georgia. Dr. Goza was involved in the Hub and Spoke Quality Improvement Initiative and the development of the current American Academy of Pediatrics Strategic Plan. She represented the Academy at the Council for Medical Specialties Societies. Next, we have Dr. Lisa Piercy, who is the Commissioner of the Tennessee Department of Health, appointed in January of 2019. Dr. Piercy earned a bachelor's degree from Lipscomb University, a master's degree from Bethel University, and a Doctor of Medicine and Podiatrist residency training from East Tennessee University Quillen College of Medicine. Prior to serving as commissioner, she served as Executive Vice President of West Tennessee Healthcare. Dr. Piercy is certified by the American Board of Pediatrics in both general pediatrics and in the specialty field of child abuse pediatrics. And our third panelist is Dr. Robert Redfield, who is the Director of the Centers for Disease Control and Prevention. He has been a public health leader actively engaged in clinical research and clinical care of chronic human viral infections and infectious diseases, especially HIV, for more than 30 years. He served as the founding director of the Department of Retroviral Research within the U.S. military's HIV research program and retired after 20 years of service in the U.S. Army Medical Corps. Following his military service, he co-founded the University of Maryland's Institute of Human Virology with Dr. William Blattner and Dr. Robert C. Gallo, and served as the Chief of Infectious Diseases and Vice Chair of Medicine at the University of Maryland School of Medicine. I'd like to ask each of our guests to take a few minutes to introduce themselves and to discuss their approach to the issue of school reopening, and then we'll have some questions and answers. Dr. Goza, can we start with you?
Thank you.
I think if you just talk.
Thank you, Assistant Secretary McCants-Katz, and good afternoon. My name is Dr. Sally Goza. I'm a practicing pediatrician from Fayetteville, Georgia, and I'm president of the American Academy of Pediatrics. The AAP represents over 67,000 pediatricians across the United States. It's an honor to be here today to talk about how to do the best we can for our children in these challenging times. Thank you for fostering this important dialogue. Children get much more than just an education at school. Being away from peers, teachers, and school services has lasting effects for children. Because of this, the AAP carefully weighed the evidence and determined that our shared goal should be to have students physically present in school this fall, if at all possible. Even though this will not be easy, we strongly advocate that all policy considerations for the coming school year should start with this goal in mind. This should happen with careful measures to keep students, teachers, and staff safe, and with the flexibility to adapt as needed to the community's prevalence of COVID-19. Of course, returning to school must be done safely. It is important to make the school environment safe for all those in the building. School leaders and state and local public health officials will need to work together to ensure safety for children, teachers, and staff. We all will need to be nimble and flexible and ready to switch gears based on factors including each community's prevalence of COVID-19 cases. I will share some of the rationale that went into the Academy's thinking. First, we considered what we know about children and coronavirus. The evidence we have so far indicates that children and adolescents are less likely to have symptoms or severe disease resulting from SARS-CoV-2 infection. Studies so far have also shown that children are less likely to become infected and they are less likely to spread infection. COVID-19 appears to behave differently in children and adolescents when compared with other common respiratory viruses such as influenza and RSV. Second, we considered how crucially important physical presence in schools is for children. Students who are in school learn more than math, reading, and science. They also learn social and emotional skills, get healthy meals and exercise, mental health support, and other things that cannot be provided with online learning. Lengthy time away from school makes it difficult for schools to identify and address important learning deficits, as well as child and adolescent physical abuse, substance use, depression, and suicidal ideation. It is also important to stay focused on considerations and accommodations to account for the diversity of youth. With the goal of safe return in mind, we must pay special attention to vulnerable populations, including those who are medically fragile, live in poverty, have developmental challenges, or have special health care needs or disabilities. It is also critical to reflect on the differential impact SARS-CoV-2 and the associated school closures have had on different races, ethnic, and vulnerable populations. This pandemic has been especially hard on families who rely on school lunches, have limited access to computers and the internet, or do not have access to health care. Schools play a critical role in addressing racial and social inequity, and we must keep that at the forefront of this discussion. Cloth face coverings, frequent hand washing, and cleaning should be implemented. Physical distancing is important, especially for adults, including teachers and staff. The Academy has also offered age-specific guidance on the physical distancing among students. Children absolutely must be up to date on all vaccines, and AAP recommends that all children are vaccinated for the flu and have had their physicals. Existing school immunization requirements should be maintained and not deferred in response to coronavirus. New measles outbreaks or flu can cause severe illness or be life-threatening and should not be taken lightly, especially in the midst of this pandemic. Decisions to alter the school schedule, such as partial days or alternate attendance days, or to temporarily close schools, must be made by local and state officials according to the prevalence of COVID-19 in the community. We believe the goal should be to have students physically present in school as long as safety measures for students and staff can be met. Schools should anticipate and be prepared to address a wide range of mental health needs, as we've been talking about, of children and staff when schools reopen. The emotional impact of the pandemic, including financial concerns, social isolation, and growing concerns about systemic racial inequity, coupled with prolonged limited access to critical school-based mental health services and the support and assistance of school professionals, demands careful attention and planning as well. Reopening schools in a way that maximizes safety, learning, and the well-being of children will clearly require new investments in our schools. We call on our leaders to provide the resources necessary to ensure that funding does not stand in the way of safely educating and caring for our children. Thank you for the opportunity to be here today, and we look forward to partnering with all of you.
Thanks very much, Dr. Goza. Dr. Piercy, would you say a few remarks?
Thank you, Dr. McCants-Katz, Dr. Redfield, Dr. Goza. On behalf of Governor Lee and myself in the state of Tennessee, we're very proud to be here and represent the approach that we're taking in Tennessee. And the overarching principle we're using is this virus isn't going to go away. We've got to learn to live with it. Our economy depends on it. And getting kids back into school is critical for our economy, and it's critical for their health. Because if you remember, education and economic prosperity are both key drivers of health outcomes. And so we see it as a health imperative, and particularly an economic imperative in Tennessee, to get back to work and get kids back to school. So in order to do that, Department of Education and the Department of Health has really tried to offer a realistic and an executable and a boots-on-the-ground approach to how to do this. So in early June, we released a pretty comprehensive, about 44-page overview guide for school districts. And ever since then, we have continued to trickle out toolkits. And these toolkits contain very specific information on things like early childhood, transportation, mental health, the real nuts and bolts that school systems need in order to get back to work. And the other thing we've done that I think is very important as a pediatrician is we're looking at the holistic needs of the child. We've stood up a COVID-19 Child Wellbeing Task Force, and it has everybody from educators to health professionals, community leaders, legislators, nonprofits, coming together to see how can we implement this plan on a local level, how can we rapidly respond when there becomes an issue, and how can we provide ongoing support. We see this as a health imperative and an economic imperative, and in Tennessee, we're really trying to get our kids back to school as soon as possible.
Thanks very much. And Dr. Redfield?
How do I turn it on? I think you just talked. I just talked? Okay, yeah, that's good. Thank you. I'm technically challenged, so this one works for me. First, I want to thank you all for all that you do. Second, I just wanted to underscore that it's important to consider schools
as a high priority setting within our communities, and they have a critical role. The local context and needs of schools are all unique, and as such, we need to tailor plans to reopen them in a way that minimizes the risk of COVID, while providing, obviously, the students the critical services and academic resources and social and emotional support that we've heard about that they need. CDC encourages all schools to do what they need to reopen and to have plans that anticipate that the COVID-19 cases will in fact occur. When I look at it, I think it's important that the guidance that we've put out, as the Secretary mentioned, is guidance, and I want people to see it as guidance to reopen. And nothing would cause me greater sadness than see any school district or school use our guidance as a reason not to reopen. And CDC is prepared to work with any school district or school to work through our guidance so that they can come up with their own unique plan to reopen. I think it's worth noting that CDC never recommended general school closure throughout this pandemic. We see schools, as has already been mentioned, as a vital part of our society, and we think as you measure the different risk, it's clear that we would see the greater risk to our society is to have these schools closed. So we want to work with you and work through so that parents and communities and teachers and you all have the confidence that we can reopen these schools safely. We've put out a variety of different strategies. We don't need to go through them now that people can support, whether it's schedule, class size, how you space seating, the use of barriers in the school to maintain social distancing, obviously closing shared and communal spaces, discouraging shared items, as you heard the Second Lady discuss with the art supply, posting signs to remind people. As Ambassador Burks mentioned, these young individuals can learn these skills very, very quickly. They're very astute to watching what we do. Obviously, we've done with disinfection and cleaning, making sure ventilation works properly. But the real goal here is to get these schools reopened and for the benefit of the students. We're in the process of providing more guidance and more what we call consideration documents in the next couple of weeks, one for preparing K through 12 communities to return to school safely, another one for school decision-making tools for parents and caregivers, another one for schools to be able to use for symptom screening consideration, another one for schools on cloth face coverings in the school setting, and finally, modern evaluation. But in closing, I want to stress if there's other gaps for some type of guidance or consideration, that it would be of benefit for school districts to have. We see this as a bi-directional exchange. Please bring those to our attention so we can work to, because if you all feel that they would be of benefit, I guarantee you there's multiple other schools and school districts that would feel the same, so that we can continue to provide the necessary guidance to get our schools open and keep our schools open. Thank you very much.
Thanks very much, Dr. Redfield. I have a few questions that for our panelists, and I hope we'll have people feel free to elaborate on some of these issues. I'll start with you, Dr. Goza. The American Academy of Pediatrics has really come out quite strongly in favor of reopening schools and having students physically present in schools. I'm wondering if you can speak to an idea that has been put forward that virtual learning is as good. It can be as good as face-to-face learning, and what's the impact of students being out of school for long periods of time?
So we looked at that, and we looked at the social and emotional skills that children learn in school, and also just the fact that not all children are able to do the virtual school, the online school. Some people do not have internet. Some parents have to work, and so their children are in daycare, and they come home at night and try to do the schoolwork at 6 and 7 o'clock at night, which just doesn't work very well. I've had patients in my office that that's been the case. And some children, especially children that have attention issues, it's really hard to sit in front of a computer for a long time. We've done meetings and about an hour is about all I can take, and I have to get up and move around and then get around, and it's very hard to pay attention. So we feel like that for a lot of children, the in-person school is better. There are some children who do wonderfully with online school. I mean, we have children in charter in the cyber academies who do fine, but we do feel like for the majority of children that interaction in-person school is better.
Thanks very much. And does the American Academy of Pediatrics also weigh in on the before and after school programs as well? Do you see the schools being a place where all of these programs can continue?
We have not weighed in on that, and so I will take that back to our school health experts and ask them to look at that as we go forward. Our guidance is updated at least every 30 days, so I'm sure we will be looking at that because that will probably be a question that gets asked of us many times.
Okay, all right. Dr. Redfield, I was wondering if you could say a little bit more about CDC's work in this area. CDC has really worked very hard to develop guidances in many areas to help Americans to safely resume many types of activities. I'm wondering if you can talk about how CDC can reassure Americans that it's safe to reopen schools.
Yeah, I think it's really important to emphasize, and I've said this before, we're not defenseless against this virus. We actually have very powerful weapons. And that is something as simple as staying 6 feet apart. This virus has a defect. It has a difficult going human to human, that distance. We have a second important defense mechanism, and that's facial coverings. And clearly you heard Ambassador Birx make the comments of how important it is for us now to really embrace facial coverings across the board. And the third, obviously, is to increase our practice of hand hygiene. These are powerful. We just looked at our household contact studies that we're doing at CDC, and it's very interesting. Those cases that were defined within a couple days then went into a household study to see what happened in the households. And in the household studies that I looked at so far, those index cases that truly practiced those social distancing techniques that I just mentioned, while they were in the household with individuals who weren't infected, we didn't see transmission. But in those households that didn't, we saw over 75% of the individuals in those households become cases. So in this method of social distancing, face coverings and hand washing really does work. And I think it's important for everyone to understand that. So having that security that we're not defenseless against this pathogen while we're waiting for better countermeasures. So I think, and clearly understanding that implementing those strategies in a meaningful way in the school setting can really be done in a safe way. The most important thing that we need to focus on, it's a big point that Ambassador Birx has raised, is that we have to stay focused on protecting the vulnerable. Those individuals that have multiple medical conditions, those individuals that are elderly with multiple medical conditions, really need to look at making sure that we continue vigilance in protecting them from the potential of infection.
Thanks very much, Dr. Redfield. Dr. Piercy, I'd like to ask you about what Tennessee has been doing to prepare for school reopenings. If you could speak in maybe a little more detail, as I think that could be really helpful to those that are starting to think through those issues for themselves. Elementary, middle, and high schools, all different, and I'm wondering, what kind of guidance has the state offered to your communities, and who have you brought to the table to come up with the plan that you have?
Sure, those are great questions and questions that we're thinking about every day. As you mentioned very astutely, there are different needs based on different ages of children. And even going down to early childhood, it's pretty unlikely that a preschooler is going to keep a facial covering on. So what can we do in order to mitigate the spread in those early childhood classrooms? Compare that to older children, middle schoolers and high schoolers, who would tolerate that better and could be more compliant. But it's not only about that behavior in our children, but it's about setting up the physical environment. So in Tennessee, in the Department of Education, the Department of Health has tried to offer both broad conceptual guidance as well as concrete practical tips. Even things that are incredibly useful and easy to do, like making 90-second videos for teachers to say, if your classroom looks like this is how you should set it up. Or this is how you get kids to go in the same direction in narrow spaces. And so very practical tips that our teachers can use. The other thing that we have done and we feel is really important is making sure that our schools are adequately equipped. And it takes a lot of hand sanitizer. It takes a lot of soap and water. It takes a lot of personal protective equipment for school nurses. We're leveraging our EMA agency in order to be able to provide for those needs for schools so they can safely reopen. And more than anything, providing actual education on the disease, but also on how to rapidly identify and mitigate any cases that will inevitably pop up. And that also takes into consideration setting appropriate expectations for parents and for teachers and for staff. Because with the enhanced vigilance of all of the different factors of parents, when they think that their child is at risk, they may take extreme measures. And so if they hear of a first case in the school, what we don't want to do is them to immediately take their child out of school, because that's not what is best for that child and the holistic needs of that child. So setting expectations for parents and educating them on, we have a plan for what happens, and we have a stepwise approach that we want to take in order to maximize the learning potential for those kids.
Great, thanks very much. Dr. Goza, I wanted to ask you about what you think pediatricians can do to help with this process of speaking with parents, with families, with schools, administrators. How can pediatricians help with this?
So I will tell you, our guidance came out based on the fact that we had many pediatricians calling us saying we need to know what to tell parents about school. And we need to know how to talk to them about this, and we need to be able to work with our counties and our school systems, because we want to be at the table as they decide how we're going to do this and how we're going to do it safely, so that children and teachers and staff are all protected as they go back to school. And just about the realistic expectations of we may start back in school, and we may have to change gears as we get into school if the prevalence increases in your community. So we have a campaign out, Call Your Pediatrician, and I tell people, if your parents have questions about whether they should go to school and what they should do about their children with special needs, or they have questions about this, call your pediatrician, because they're willing to talk to you about this. We're there to help parents make the best decisions for their families as to what's in the best interest of their children and families.
Great, thanks very much. I want to ask both you, Dr. Goza, and Dr. Piercy. One concern is that we know a lot of parents are very anxious, so much so that some don't take their children to pediatricians for healthcare visits because they fear that there may be something at your office that could cause their children harm, that their children could become infected, that they could become infected. So how do we reach parents to let them know the facts about the importance of addressing health needs, with school being an important part of a child's health needs?
I think the key word that you just mentioned was facts. Because, like all of us, there are lots of different sources of information coming at us all day, every day. And we have to be able to parse through what is reliable and trusted information. And so giving parents those facts about not only the safety in getting back to a pediatrician's office, but the consequences of what can happen if one doesn't. It's been mentioned multiple times here already today, but I am deeply concerned about the decrease in immunization rates and the decrease in the amount of all patients, children and adults alike, presenting for typical health conditions. And so what we might find ourselves in is a situation where it would be even worse than just COVID alone. And so I believe that all starts with education. The AAP is an incredibly trusted partner in providing that, as is the CDC. And so that would be my key take-home message to parents, is find your news from a reputable source.
So at the AAP, like I said, we started our Call Your Pediatrician campaign. I hope y'all all saw the little panda who got his checkup. And we said, if the panda can get his checkup, your children need their checkups too. It's a very cute little video. But anyway, so we've been really working on this. I've been doing a lot of interviews telling parents, call your pediatrician, because we don't want children to have misdiagnoses. We want children to get their vaccines. And we are a safer source of information. But the American Academy of Pediatrics also has a parent website called healthychildren.org that has lots of information there about COVID-19. It has our school guidelines, school reopening guidelines on there. And so there's information there for parents as well. So I would encourage everybody, if they know anybody, say healthychildren.org is a great source of correct information for parents to access as well.
Great, thanks very much for that information. Dr. Redfield, can you comment on what we know about the epidemiology of this virus in terms of its effects on children and adolescents?
Well, I think first, I think it's important to realize that we do know this virus obviously infects all age groups. It's not clear to us yet, and as I mentioned, our household studies, the role that children play in the transmission cycle. For example, in our household studies so far, there was limited implications that the virus was brought into the household by a child. This would be different, say, than influenza, where it really drives the epidemic frequently, children transmission in schools. But what we do know is that this virus also has probably one of the widest ranges of disease penetration, from totally asymptomatic, to mild symptoms, to symptoms to the point you go to the hospital, you have some pulmonary insufficiency, all the way to ICU and death. So it's quite a spectrum of disease. And it does, I think when we looked at individuals under the age of 45, they represent 2.4% of all the deaths in this country. And when you look at them, those individuals under 45 frequently had a significant comorbidity, significant obesity, diabetes type 1. So this virus does seem to be very limited pathogenicity for children. Now there is an exception. There's a post-inflammatory syndrome that is very rare. There's several hundred cases that have been reported where it appears that the immune response to the virus causes a post-inflammatory syndrome and can be quite significant. And maybe our colleague wants to comment about it. But I think that's important, that really the individuals under the age of clearly 45 that don't have a significant comorbidity, that this virus has very limited pathogenicity. I would be remiss, since I may not get another question, just to ask the one thing that I do think it's important for me to be the advocate for all of you, is that this is the year to really promote influenza vaccination. And I think people know that I'm quite concerned about the fall and winter when we have these two respiratory pathogens emerging. And it can be very complicated, obviously, in the school setting if we all of a sudden have an epidemic of a respiratory illness. The only difference is flu is likely to be symptomatic in the children, all right? And of course, the COVID is likely to be asymptomatic. But this is the real year to try to really embrace vaccination with confidence, particularly for flu vaccine.
Dr. Goza, do you want to comment any further?
No, I think Dr. Redfield covered the post-inflammatory syndrome very well. It's still very rare, lots of more information to be learned about it as we go forward, but there are people looking at it very closely at the Academy and trying to figure out what we need to do.
Okay, great. And no worries, Dr. Redfield, I do have more questions for you. Dr. Piercy, Tennessee has many rural communities, And we know there are a lot of challenges to virtual learning. They may not have broadband access, but there are also transportation challenges for children going back to school. How's Tennessee addressing the issue of transportation in the reopening process?
Yes, ma'am, you bring up a good point that we have a very wide geography in Tennessee with a lot of diversity. We have rural counties that, believe it or not, are still in the single digits of case counts. We have metro areas that are exceeding 12,000. And so in Tennessee, we've learned that one size doesn't fit all. There are specific needs in our rural communities, like transportation, like technology. And so that's why it's been important for us to be able to work on the local level to individualize the response. Transportation is one of those things that a lot of our rural children rely upon. And so we have to be able to do that in a safe manner. Things like skipping seats or cohorting kids in seats that are in the same household. And we are also working with very practical tips for bus drivers. It's not practical for a bus driver to screen kids as they come onto the bus. And so whether that's an at-home attestation prior to getting on the bus, or whether that's screening immediately after departing the bus, those types of practical tips are ways that we're addressing transportation, for example. And that's something that our districts are looking for. They're looking for that very specific blocking and tackling day-to-day guidance that they need to be able to offer a safe environment for their children. And so in Tennessee, we've created toolkits, and toolkits from transportation to how do you do meals, how do you do choir and band, things that have been mentioned before. And then something that's very popular everywhere, but particularly in the South, how are we going to do football in the fall? And so these are the kind of things that we're looking at and working with our stakeholders every day.
Great, thanks very much. I have a couple of questions that I want to just pose to everybody and give everybody a chance to answer. The first was, I'm wondering if you all go out and you travel a lot, you talk to a lot of people. I'm wondering if you can describe an issue or a concern that someone brought to you in the process of considering school reopening that surprised you or concerned you because maybe it wasn't factually based. And I'm just wondering how you dealt with that. Dr. Pearson?
I can go first.
Okay.
You know, something that we have seen, and we've put it sort of on our best practices list, is there is a very rare instance when an entire district has to be closed. And I know that was the approach at the beginning, and it's been referenced earlier, these wide, sweeping restrictions. But as we're going back to school, we really need to talk about an individualized and very specific approach. It may be that in the inevitable case that these infections come into schools, that you close a classroom, or you close a wing or a corridor, and perhaps the entire building. But that's something that we heard that it's an all or none on a district opening or closing, which is really not based in science and is certainly not the best way to educate all of the children across an entire district.
That's a great point. Thanks very much.
So I'll have to disagree. I haven't been traveling much since March. I've been in my office and in my home, and I have a little corner of my office that is now called my studio for when I get interview requests. But so I think one of the biggest questions I get from parents is, but what if they come home and we want to go visit the grandparents, and they've been exposed then, and how do we keep our grandparents and our family that may have health issues safe? And so I think that's a big question that's on the minds of a lot of parents, and just reassuring them that the schools will be safe, and that we will have that information, that if we do see COVID in the schools, that the parents will know about it, because I think they sometimes think that the schools keep it secret, so they don't want to let them know that they've been exposed. I don't think that ever happens, but that's kind of their thought process. And so reassuring parents that the school systems, the public health, and the pediatricians will all be working together to keep their children safe is very important.
Yeah, I have two maybe quick things. One is, I think one of the biggest challenges we're having right now is how to really communicate the message of the importance of social distancing, mask and hand hygiene to the millennials and Generation X individuals. I don't think we've been very successful in that. And, you know, we've talked about it. I know when I call my children on the phone, I never get a response, but when I text them, they get back to me within about 5 minutes or less. I do think we need a strategy. I don't think we've hit home there. I don't think the younger group understands how important it is for them to fully participate in the social distancing. The other is that we talked about, you know, that this isn't all or none. There's a lot of space in between, and I think we have to be more open to embracing those gray zones. And I think the one as a physician that's probably saddened me the most, and I've been involved in this, is individuals that are in end of life, and they've really been denied any access to their family members. There clearly is a safe way that those family members could have had access. When I see people dying talking to their parents on the phone, it really kind of bothers me. So I do think those are the two things that I think we as physicians and healthcare professionals, it's not black or white. There is a gray there, you know, and we can find a safe way for that gray to take place.
Thanks very much. Those are very important points. I want to ask each of you to just comment about what we should be doing in an ongoing fashion. So we've talked a lot about the process of reopening schools and the importance of that, but what should we be doing to continually reassure parents, families, those that work in our schools, that the school is safe, even if there's a rise in cases in the community?
I think one of the lessons that we've learned, not only as it pertains to schools, but in the entire response, is to avoid extremes. And when everything is one way or the other, that doesn't lend itself to learning and to applying new learning about what we're finding out about this disease process. And what happens when one takes one extreme or the other is that when you get new information, you suddenly perpetuate mistrust. And we want parents to trust us, and we want parents to be able to rest safely or rest assured in that their children are going to be taken care of safely. And so I think transparency is a really important part of that. Transparency even about the uncertainty. I'm not sure anybody's got this completely figured out yet. And no school district has this completely figured out yet. And I guarantee there will be something that happens that's unexpected. And so communicating that transparency to parents and setting that realistic expectations of this is our plan right now, but we're in constant communication with our health officials, with our local leaders. We're looking at the data on a regular, almost daily basis and making those decisions sometimes on the fly. That's okay, because we want to be able to customize that approach to what's best for that school at that time. And so really communicating transparently and ensuring that everybody remains flexible in the process is really important.
I think that goes back to our saying that we have to be able to switch gears very quickly and be very nimble and flexible. We are learning about this disease. If we went back to what we said early in March, it's totally different than what we know now, or not totally different, but a lot different. And we've started doing guidelines instead of policies at the Academy related to COVID-19 because we do know that we need to review them very frequently because they are updated very often with the new data that we have. And so in letting parents know that we are watching that data, we are watching what's going on, we are going to be able to change as the information that we receive changes and the data changes.
Yeah, I think it's important. When I made my opening comments, I made the point is that we need to plan to open these schools with the understanding that COVID-19 is going to occur. I really think it's important to get ahead of the curve for schools and parents and teachers to kind of understand ahead of time how that school is going to respond when in fact they do get a case or a cluster of cases, you know, as opposed to necessarily getting the storyboards going and overreacting and really starting going down a path. As you know, I mentioned that CDC did not recommend the schools be closed. But obviously the civil leaders made that decision. I'm not critical of it. I'm just saying from a public health point of view, we didn't see that schools needed to be closed generally. There may have been in certain schools that we saw should be closed because of outbreaks, just like we do for influenza. When it occurs, we shut down sporadically a school here and there to try to close the epidemic, or measles. But I do think getting ahead of the curve that you're talking about, how you're going to handle cases of COVID in the school when you diagnose them, so that doesn't become some type of 9 o'clock at night phone call tree that goes through the community, and the next thing you know, you have the school shut down for a week, rather than everyone being on board how we're going to handle this. I think that's really important.
Thanks very much. We have time for one last question, and that question is, for each of you, what would be the one key take-home message that you want people who hear this to get today?
So in addition to being a state health official, my more important role is I'm a mother of 4. I have one that's about to start college and then 3 in high school. And what I want to know is that my children are going to be safe. And I also want to know that I can trust those making the decisions, that they're going to take all of this into consideration when they're making these incredibly impactful decisions. It was mentioned earlier, but even those of us who have resources and have good coping skills, our children have struggled through this. And they don't, fortunately, have to worry about some of the other very serious social issues that some students do. So recognizing that this impacts all students, taking this approach to getting our kids safely back into school is probably one of the single most important things we can do to reopen our state, reopen our economy, and get on with our lives.
So just like our guidance says, we do believe that the goal should be for every state to have the goal of in-person school, but with those schools opening safely.
And I would just echo the most important thing from my point of view, from a public health point of view, from a risk versus risk point of view, that we need to reopen our schools. And we need to plan to keep our schools reopened. I think this really is the important message, and this is why we're having these discussions, to get people to understand that we need to reopen the schools. We can do this safely. We need to commit to it, and we need just to get it done.
Well, I'd like to thank all of our panelists for a really interesting and important discussion. And I hope that this will help our communities to think through the reopening of their schools and what that's going to entail. Thanks very much.
Thank you, everyone, for sitting down so quickly, being so attentive. I have the pleasure of introducing our next panel, effectively implementing safe school reopening. And I have the pleasure of introducing the moderator for the panel, who's actually going to introduce all of the panelists. So Frank Brogan is the Assistant Secretary for Elementary and Secondary Education, a longtime educator himself. He is keenly interested in hearing from, and we are all interested in learning from those who are well down this path, how you're thinking about this, and how each state and locale is looking at the different factors for your particular communities. So with that, I'll turn it over to Frank Brogan to introduce the panel.
Thank you, Secretary, and thank you all for being with us. I can't tell you, as this was being put together, how flattered we all were at the incredible number of and quality of the people who agreed to participate in this. And I think that credibility is going to help the message coming out of these meetings go farther faster because you are a part of it. So thank you for that. I'm going to introduce our panelists one at a time and then ask them to come forward. We like a flourish on this panel, and we thought we'd start that way. In no order of import, because they are all equally important. Yes, I was a 5th grade teacher at one point. I would like to introduce Dr. Sue Elsperman, who is the president of Ivy Tech Community College in Indiana. I was sharing with her that we share a lineage. I was born in Indiana, but I also was the lieutenant governor of the state of Florida, she having been the lieutenant governor of Indiana. So we've got a lot going on here. She is a longtime educator, higher education, and we thought on this panel it was important to have all bases covered, not just K through 12, but higher education as well. So, Doctor, thank you very much for joining us. We're delighted to have you today. Also, a friend of mine and a colleague, Margie Vandeven, who is the Commissioner of Education for the Missouri Department of Education. Margie, welcome. Having been Florida's Commissioner of Education, I know what she does, and it's a heavy lift in every state, but we're delighted to have her with us. She has more than 27 years of student-centered service in education, including 3 at Missouri's top educational posts. She's a teacher who has provided education leadership in the classroom, and we are indeed delighted to have her and her unique perspective as a chief state school officer on the panel with us. Next up, Nancy Eichholz, who is the school board president for Indian Hill School District in Ohio. Her professional background, Ms. Eichholz currently works as the president and CEO of Aviatra Accelerators Incorporated in Cincinnati, Ohio. She has a great education background. In 1984, attended, and I will say it because I grew up in Cincinnati, the Ohio State University in the state of Ohio, a bachelor's degree in business admin. She also attended the Kellogg School of Business for an MBA and executive program. And we're delighted to have her, and again, another unique perspective as one of those responsible for implementing all of the things we're talking about in terms of going back to school this year. Next up, a fellow Irishman, and therefore believe about 50% of what he says. He also is a school principal, as was I at one point in my career, and is currently the principal at St. Vincent de Paul High School in California. This is a high school, take it from me, that has an incredible reputation, and we were delighted to have him come all the way from California to join us. He's got more than 20 years of successful experience as a teacher, a coach, an administrator. He knows the high school I went to in Cincinnati, and I know the high school he is now attending to in California. We're delighted to have Patrick Daly with us today. Welcome, Patrick. And last, but as they say, certainly not least, we needed a school superintendent. We found one, and a darn good one. We have Dr. Jeff Bearden. He joined the Forsyth County Schools as superintendent on September the 7th, 2014, and has served as a school executive for over 25 years. He knows not only the education layout, he knows the business and administration side of all things education. That will be invaluable to this country as we do go about the business of reopening America's schools. He has served as an assistant superintendent, assistant principal. He's been an athletic director, and really has a tremendous reputation out there in the world of education. Would you first help and join me in thanking our panelists for being with us today? And I'm going to make 2 very brief observations, but then we're going right to the panelists because we will run out of time. We have a larger than typical panel, so I want to give everybody a good opportunity to share what they are doing, not thinking about doing, what they are doing to prepare to open America's schools in the fall. 2 simple observations. First of all, the timing of everything that we are doing. I go all the way back to my childhood and remember that when I waved goodbye to everybody in my school, I knew it was going to be an incredibly long time before I saw my friends in many cases, certainly my teachers, But it always seemed to amaze me, and over it occurred in the summertime, how fast it would be until I laid eyes on the first back-to-school commercial on television. First of all, thought how unfair that was to do to me, a practicing layabout every summer, to quickly tell me, get ready to go back to school, you'll need new shoes, but also it's helped me over the years recognize how fast that summer goes. And not just for students. As a fifth grade teacher, it was equally fast for me in that capacity as well. I make that case because while we keep talking about reopening America's schools as some futuristic proposition, start putting an X on the calendar on every day that goes by. It will be here before we know it. The second observation I have learned while serving with and for Secretary DeVos. I am the Assistant Secretary for Elementary and Secondary Education, and a lot of things fall under my purview, as you might imagine, in that big Department of Education. One of them is to serve schools in America that have been victimized by natural disaster. If you stop and consider the number of these events that take place on an annualized basis across America and even out into the Pacific and the Atlantic, because we serve everything from the Northern Mariana Islands in the Pacific to the Virgin Islands and Puerto Rico in the Atlantic. And by virtue of that fact, everything in between. And what you see, sometimes almost quietly, are major natural disasters that unfold that hit schools and school districts across the country. And Congress has, since Hurricane Katrina, been providing funds for these named events so that schools can, and this is the title of the program, restart. Why? Because Congress and the country have recognized more and more how vital operating America's schools are, not just for the obvious, the education of the children in them, but because they are the community in so many ways. And take one of those schools offline and consider the repertoire. You're talking in this office and what we do with a disaster recovery unit that works on this every day, all day. It's everything from typhoons to volcanic eruption, to floods, to hurricanes, to tornadoes, to wildfires, and I can go on and on. You can see these things in the headlines of some of your papers out there, I trust. But it is all focused and centered on getting these schools back up and operational, even in cases where schools have been wiped off of the face of the earth physically. Getting those children reorganized and back to business as rapidly as possible. And that continues now with something we thought we'd never see, which is a global pandemic, and all of America's schools being taken in some way, shape, or form offline. And so this conversation is so important because it's with people who are the practitioners. These are the people and the people they represent who are responsible for getting our schools up and operational, creating, again, safe environments where teachers can teach and children and students can learn at all age group levels and be able to come back to a normal environment as rapidly as possible. But last comment, knowing there are no guarantees here. We guarantee that we want to open all of America's schools. We know, however, with this unprecedented and this complicated virus that we're all fighting out there, how we do that is probably going to be different place to place, situation from situation. And that's the enormous challenge that our practitioners face out there every day. The high water mark, of course, will be opening all of America's schools. And while that sounds simple, that in itself is a major complication. But knowing that with each passing day and this unprecedented environment that we're in, we may have to look at each school a bit differently, even in school districts, much less in states and across the country. That's the challenge that our implementers face. So I'm going to begin with one question, same all the way down the row, a bit of a different question coming back this way, and then want to hear from each of you individually as to what you are doing and the steps that you are taking. But the tee-up question I want to provide for you, starting in this direction, is what is one major concern with the possibility of school reopening in the fall? Again, what is one major concern, that's all you're allowed, regarding the possibility of schools reopening in the fall? There are probably lots more than one.
So representing community colleges is, will the students come? We're still running, and most are running about 20% behind on enrollments. Many parents have said, well, maybe, or the students have said, maybe I'll take a gap year. That's about the worst idea I've ever heard. But also, our students in community college are low income. They are the most vulnerable. They have lost their job. They are trying to decide how they're going to make ends meet and can they afford to come back. So that's the one concern of many that I have.
You're not the only one that has that concern in higher ed, I trust. That's a fact. Commissioner, how about you?
Boy, many concerns still, but really eager to get back in that classroom. And I will say probably on a practical level, the one area that we keep coming back to is transportation. So your question of how will they get there, will they come back? Ours is how do we make sure kids can arrive at our doors safely and be returned home safely? Because the safety of our children, we always say, is when we pick them up in the morning and we return them in the afternoon. So thanks.
Outstanding. Madam President.
So for us, one of many concerns, we are very motivated to get our children back in school. Our teachers are motivated, our board is motivated, everyone, parents are definitely motivated. However, the concern is getting everyone back and then having an issue or an outbreak and having to close back down or to quarantine certain classes, the disruption of that we get into a flow that I think part of the value of education and one of the assets is that consistency. We get everybody back, they're in a routine, they're finally comfortable, and then all of a sudden we have to send them back home again. And that, I think, is one of the biggest things on our minds, and we're really working to plan accordingly. But of course, we have no idea what the unknowns could be.
Thank you, Nancy. To our principal.
I think I agree with the three ladies. Those are concerns that we have. Also, the concerns that we have are, we're a private Catholic school, so tuition revenue is our revenue source. We do not receive state or federal funding. So parents' confidence in the plan that we're putting in place, making sure that their children will be safe on our campus, making sure those tuition dollars are well invested, and an increase in expenses of all the procedures and policies we're having to put in place in order to make sure it's a safe place.
Well said. And to our superintendent, and the buck usually stops right there.
Well, for us, it's having to return to full-time virtual would be our biggest concern. I'm really proud of how well our teachers pivoted to that environment last spring. I think they did a masterful job. The vast majority of our students remain engaged in the virtual environment, but I think we can all agree as we sit here today, our children need to be back in school, and we want them back in school. We plan on opening on August 6th. I know that's a lot earlier than many school systems around our country. We think it's just incredibly important to get our kids back into school early. In the case we do have to pivot back to virtual, at least we will have established those relationships early on, which are critical to learning.
Jeff, thank you. Well said. And I'm going to stick with you as billed, and we're going to come back this way. I'm going to take the question I just asked and turn it on its head and ask each of you, what is one major concern with the possibility of schools not reopening in the fall?
Well, I think we've heard, from our panelists today, our kids need the social experience of school. Of course, academics is important, rigor is important, but the social and emotional well-being of our students is critically important, and we cannot deliver the services they need if they're at home. So we desperately want them to come back so we can serve them well.
Well said.
The concern that we have is our county, Sonoma County, making a decision that they're going to continue a shelter or have shelter in place. We have students that range from Marin County, which is south of us, and Sonoma County as well. And the fear is continuing distance learning. I just don't think it's beneficial for brains that are 14 to 18 years old. And I think it's really important for a variety of reasons why we should return to school. And we plan to return August 10th, and that has been the plan since March 17th when we closed our school. So our plan was immediately to return and put all the policy and procedures in place to ensure that.
As a lot of you in this audience know, there's a phenomena that plays out every year when students go away for the summer and come back in the fall. It is renowned as the summer slide, which means how much regression did a student deal with from the time they left and what they knew to the time they came back and what they forgot in between. Summertime for many, many children, not exactly an Olympic event in the world of academia. So by virtue of that fact, can you imagine 6 months in some places of what was a 2.5-month summer slide that is now a 6-month period of time, and what the returning students are going to be dealing with when they come back? So well said.
So I think if we are unable to return to school, it is just catastrophic. I can't even imagine the fallout. And I think we've all addressed the student issues, of course, and that is paramount in all of our minds. But I also am very concerned about our teachers and our staff. They want to get back to practice their craft and their trade. They're good at it, and they're best at teaching in person. They love these kids. It's an emotional attachment for them as well. And so I do worry about our adult staff. Many of them are in the age range where they have also young children at home. And so if they are trying to teach everyone else's children online and deal with their own children, it's not good for anyone. So I think I just want to kind of put that plug in for our teachers and staff. We can't forget about the adults that serve our children.
Absolutely.
Okay, and as you know, at a time when the chiefs across the entire nation have committed to serving every child, this equity component is so important for all of us right now. For me, the concern is how we're seeing this building closure just magnifying the opportunity gap, the achievement gap, all of the experiences that our children desperately need, and we see that growing. So when you talk about the learning loss, I think it's real. We see it's magnified. Particularly concerned about our youngest learners, knowing what we know about brain development. A 5-year-old can't afford a gap year. So I mean, you know, talking about a gap year, I get your point. We don't want to talk about it, but think about what that does for a 5-year-old. So I think those are our biggest concerns: is closing that real opportunity gap for our kids, and making sure that our earliest learners are right there with their other college kids.
Thank you.
So with a large community college, we're still running. We kept running in the spring. We're running this summer all virtually. However, what's hurting is workforce. So we can't run our welding classes. We can't run the programs that require the hands-on learning right now. Actually, this week we started completion academies. So we have actually started back up to bring those hands-on learning with social distancing, very carefully with masks, but we're beginning to do that because our employers need it, and we know we are what stands between our students and having a prosperous future and meeting the needs of our employers in the community. So we're going either way, but we will miss many if we're not able to fully open.
I was speaking with a friend of mine who is an administrator in another state, and he committed to me that we have a plan. I said, I don't want to rain on your parade, but if I were to give you any advice, it would be have more than one. The problem with what we face today is the unknown. While we all want to get to the same place, we want to reopen America's schools, what we may have to overcome in order to do that, up to and including after the technical beginning of the school year starts, is yet unknown. And by virtue of that fact, most of the people that I know out around the country in the field, and this is both K through 12 and higher education, are developing multiple plans. We all call them contingency plans, just in case plan A doesn't completely come off the way we'd hoped it would. How are we going to make certain that all students have access to a quality educational experience on the first day of school? All of them. And if it is not all together in one location, what are the alternatives that can be provided along the way to make sure that if a campus can't open, education still has to? And what plans are we putting in place to make that happen? And I'd like to throw that out to any of our panelists. I won't hit all of you on this one, just those that might want to take a piece of that one. Can I pick on you for a minute?
Absolutely.
That's what lieutenant governors are for. Higher education has been at distance learning a lot longer than K-12. One of my most disappointing moments was to witness firsthand on a national scale the anemic pivot from traditional programming to the world of distance education. It was anemic in most places. It was non-existent in far too many. And by virtue of that fact, schools just began to shutter because they had no other alternative but to close down. If we don't learn from that and make certain that we consider technology our friend in what happens in how we reopen and how do we deal with children who can't come on the first day of the school, whose parents perhaps may not want them to come back immediately until they see how this is playing out, how are we going to guarantee we just don't mark them absent, but we provide them a high-quality educational experience?
So higher education has been at online learning for a long time, for decades. And at Ivy Tech, we're 100,000 students plus 60,000 dual credit, those high school students of yours that we do as well. And it's just been growing exponentially because our students need it. If I'm a single mom, I can't come to campus all the time, right? So online learning was something we had to do. We weren't as good at it as we needed to be, so we've been reinventing it at Ivy Tech and have eliminated most of the gap between the face-to-face and online, which is one of the real challenges. But because we had the capacity, we were able to make that shift quickly. And we had already gone to a lot of hybrid, which would mean you come on campus once a week, but you do something else from home. So having both. Now what we're piloting in the fall, which if I can share is very exciting, we call it Learn Anywhere, where every week the student decides if they're going to come on campus, if they're going to do it virtually, or if they're going to do it online asynchronously. Now that is really meeting our student where they are. We'll have about 400 sections of Learn Anywhere this fall. And I can just say, if my faculty are watching right now, thank you. Because you can imagine how difficult that is. But it's at every attempt to meet them where they are. But of course, we need the hands-on. We still need the lab experiences. Those are things that we hold with very high value and critical to the programs that we offer.
Blended.
Blended in many different ways, yes.
Anybody else want to bite of that apple, Commissioner?
I'll jump in on that one. You know, we learned a lot in K-12 education in the last few months. I'm sure you all would agree with that. And I would say that education will not look the same. I don't think it will all be online, but it will be very different, I think, in how we approach learning activities. So I'm really proud. I'm just going to talk about our teachers for a moment. Our teachers have been phenomenal through all of this experience, but we have some of our some teachers who did this very, very well. It was second nature to them. Some really struggled with it. And so those who did it really well, and in fact, it was really a group of our teachers of the year, have come together and they're developing various lessons and really, we're all learning in this together. That's what I think has been so powerful about this experience, is the ability to all of us say, how do we work and how do we help one another? So I think it's that component. We've also done a learning loss acceleration team task force. They've come together. We're going to meet kids right where they are when they come in our doors. And there are two components that people are really, really interested in gathering. Is one, Where are they academically? We know we need to know that, and we know we need to, if we expect every fourth grader to walk in at a fourth grade level, we're kidding ourselves. Some of them thrived, some of them did not do as well. So where are they, and what can we help them with? But also the social emotional concept. So how do we really give our teachers the tools to sit down and really identify where kids are and help them through this process?
Well said.
Yeah, I would say, we're certainly planning on our students coming back for face-to-face instruction on August 6th, and we want as many of them to return as possible. We are a school system that serves about 52,000 children. So we have heard from a number of families that are not quite ready to send their children back to school. We've had a virtual school for grades 6-12 for a number of years, and that has served our students very well. We are in the process of developing a K-5 virtual experience right now. We will offer our families a choice when they come back on August 6th. Again, we hope they will return face-to-face, and if they do, we will have guidelines in place, many of which we've been talking about all morning. But we wanted to make sure we gave our families a choice, and we also wanted to be very prepared in the event we have to pivot again. We learned a lot from that experience last spring when we were out, and as the commissioner said earlier, many of our teachers performed admirably, heroically, I would say. Some of our teachers struggled in that environment, and so we've put together a really good professional development program over the summer, so we are even more prepared next year in the event that we have to learn virtually for a period of time. And I think it's incumbent upon all of us. The key is flexibility, adaptability, and be prepared to pivot.
One of the things in the last 3 years, in the 102-year history of the school, we've had fires, we've had smoke, we had power outages, we have a virus. We joke that we're waiting for locusts and the Petaluma River to turn to red, to blood. But the health and safety, we put together about 2 weeks ago, Dr. Adriana Rios is here with me, Dr. Steve Talk. We really put together a group of faculty members, and as everyone said, some really, we're very enthusiastic about teaching online, distance learning, blended learning. Some struggled with it, so we provided a tremendous amount of, I call it customer service to our faculty. So in order to help our students, we're a small school, just over 200 students, but we also know this is a working document. It's ever evolving. And we're looking August 10th, that we're in school with all the protocol, policy, and procedures in place. Then we have a hybrid method, which will come Monday, Tuesday off, Wednesday, Thursday, Friday. And then, God forbid, we have to go to full distance learning. So we know we have to adapt and overcome those challenges as quickly as possible. Stay positive. It's really important for our faculty and our administration to stay positive with our parents and with our kids. We've also looked at what are they doing in Australia. There are schools that opened up and 60% returned 3-4 weeks later. The other 40% came. We looked at our sister school in Avignon, France, who looked at the policies and procedures they put in place, Vincent de Paul School. We're looking at what they do in Korea with the plexiglass around the desks. We don't really want to go there, but if we have to. But I think it's really important that instead of reinventing the wheel, that there's a lot of very talented people in this room and throughout the United States, throughout the world, that we look and emulate and see if we can do the same thing.
The Secretary and some of our folks have been hosting a round of webinars of late. I don't know if any of you have tuned in yet. We're about to do our 4th and have several more through the course of the summer. They're really all dedicated to a central issue of technology and education, not just distance education, but technology in all of education. The saddest day of my career ended in New Hampshire this year when I was visiting some schools in New Hampshire, visiting schools being the favorite part of my job. Why was it the saddest day? Because I was called back because of the pandemic, and that was the last time I had the opportunity to actually visit a school campus this year. And I know how depressing it was for me. I can't imagine how depressing it was for the faculty, the principal, the students, the family members of those schools, watching their schools just almost inexplicably going dark without really any degree of warning, and then now trying to claw our way back to normal best we can. Those webinars are meant to try to do a number of things, including share best practice, but importantly, we have panelists on those webinars who share one thing in common. They haven't met a problem they couldn't figure out how to solve yet on this thing. They refuse. And it's an amazing thing. They'll tell you, oh, we ran into this problem and that problem, but here's what we did to get around that problem. Here's how we dealt with that when we overcame that problem. These are people who don't know the meaning of the word quit. And that's schools at the end of the day all over America. People who want these young people to succeed and learn and are willing to do just about whatever it takes to make that happen. I wanted to ask our school board president. Many schools were forced into distance education, and you can tell us about your district and whether or not that was the case in the spring. Generally, what impact did that have on the families? Not just the student, but on the families. A little insight, Nancy, on that one?
Well, we've heard quite a bit from our families. We have, as you know, a relatively small district, a very tight community, and our whole state shut down, and it kind of seemed overnight, sort of was. We sensed that it was coming, and we were able to do some preparation for that. Our families rose to the occasion. We have great families. But it was very difficult. We have a lot of dual career families. We have a lot of families with multiple children. We have extremely active families. So for them to go from, full tilt, which maybe isn't always perfect, to everything stopped, sports and scouts and everything else that our children and families do. And the parents are very engaged in these activities as well. I really do think that there was almost like a cloud of depression over our whole community. And I noticed in, we have an area where we can be outside and walk a lot. I noticed that people weren't really, kind of not looking at each other when they passed each other, which is not like our community. I noticed the same thing in the grocery store, even in masks. People they just don't know how to handle not being normal. And I think we all wanted to be sure that this new normal wasn't permanent. We don't want this to be our new normal. We want this to be our temporary normal. And I kept reminding people as I was talking to them, this is difficult. We have pivoted very quickly into our distance learning and did a very nice job with it. We can do better now that we have more time to plan. But we all have to keep the perspective for our own mental health. This is temporary. It's long, but it will eventually end. And so we can't plan to change our lives forever. And so I think what I saw was that kind of collective depression. Now that people can be out a bit, our pools are open, people are a little bit more engaged. We're seeing more optimism, and our parents are begging us to please get the kids back in school. Not that they don't want their kids at home, they love them, but they know what's best for their family and their children.
The Congress and the President created, and ultimately the President signed into law, the CARES Act. It provided an awful lot of things, but what it provided to us, through us in the Department of Education, was a substantial amount of money dedicated to trying to help people prepare. $13 billion for K through 12, another roughly $14 billion for higher education flowed through the Department of Education. We actually retrofitted essentially our entire Department of Education to make certain we had the appropriate documentation, accountability, invitations to participate, you name it, and it was a major process because it was unprecedented in so many ways. And yet, within a record-breaking amount of time, we were able to get that $30 billion out to America's schools so that they could quickly be able then to pivot and use it for what they needed to do in order to either remain open or open again. A big part of that, and I'm about to poll you on this, was the idea that you don't have to use it all for this, but if we've learned anything, we've learned that the technology that we lamented we didn't have enough of when this thing broke. Not all children, not all students had a device of their own to take back and forth at home. Some communities, although schools are in very good shape around the country in terms of wiring, some communities still aren't wired. So the youngster would go to the edge of the chain link fence and go dark because their home was not wired in their community. And it was about teacher training and making sure that teachers had to be trained. And this isn't just traditional teachers. This is all faculty, all staff, all administrators needed to be better trained on how to utilize the technology as we worked with America's parents to help them through this, because we were essentially had become a complete society of homeschoolers. And by virtue of that fact, we were now relying more than ever before on moms and dads and grandparents to try to help make certain that children were able to get whatever we were able to give them. So the question I would ask you all is, on the issue of teacher training, we're in the dead of summer, which is in some ways for all of us a good thing, because we've got some time to be able to do some things. Hopefully we've got some money to do it with. And I'll just call it for ease teacher training, but you know what I mean, the whole community. How's that going? And Jeff, you had mentioned yours, I think, but how's everybody else doing in the world of educator training? How's that on this score? Jeff?
Well, you know, again, I'm really proud of our teachers. You know, we don't force them to come in the summer months to take advantage of professional development opportunities, but many of them have. Many of them realized last spring that, you know, there were some gaps in their instruction, that technology could help improve those gaps. It was really interesting, you know, some of the feedback I heard from teachers was, you know, it forced me out of my comfort zone last spring. I picked up some skills I would have never picked up otherwise, and when we get back to normal, I'm going to be an even better teacher now than I was before, because I can take advantage of some of the resources that are out there that I really shied away from in the past. So I'm really proud of how our teachers have stepped up to the plate. You mentioned the CARES Act funding. I'd be remiss if I didn't say this. I am so appreciative of our local, state, and federal government, all three, how they supported us throughout last spring. The fact that testing was waived last spring was absolutely the right thing to do for our students. We were able to show our students grace. We were able to show our families grace. We were able to provide them a lot of love and support. And I would say the one good thing that has come out of this, I think our community has really come together. I think we're more connected now than we ever were before in terms of making sure children have the resources and support they need to be successful. And I'm really appreciative of that.
Outstanding. Anyone else?
What I've noticed is, well, first of all, our teachers did not get a summer. They have been working all summer long because they have to learn new skills. And when we went to distance learning in the spring, they did what they had to do, and we are a fortunate district. We have a lot of resources, and they did have the resources they needed, but they didn't have the experience. So we've invested heavily over the summer in time and money in those teachers, because we know that even if we're all back in school, we will have some families who can't bring their children back to school, whether it's because of the child has a health issue or a family issue. And that child deserves the same high quality education that every child that steps on our campus gets. And so we've invested heavily in that over the summer, and I've been very pleased to see how everyone has embraced that, and I'm excited to see what comes out of it.
Thank you. Pat?
You know, I'm very proud of our teachers, really am, and their enthusiasm during the summertime of working, and you know, mediocrity and just being satisfied isn't good enough. And we know that not only with our faculty knows that, they're very enthusiastic about learning and expanding how they get best teaching practices. We've also looked at what companies are doing as well. My two daughters work for a company called Untuckit, and how they transitioned during this whole time period. And I think it's really important to look at companies. I have Rafael Velez, who's our board chair and a parent, and reaching out and how does his company work with this? Ongoing training, and how can we make it so it's you're not sitting in front of a computer, because I think after sitting on a conference call for an hour, I think even as adults, most of us would get tired of it. So it's how do we break that up, and how do we maximize the time and maximize the resources that we have?
Well said. Commissioner?
Sure, I'll kind of feed off of both of your topics there. I have already talked about how proud I am of our teachers, and I will continue to say that, and the work that they're doing this summer. I think an area that I've been really impressed with in the summer in particular has been the CTE teachers. You talked about workforce development and trying to make sure they were equipped. They were pretty much stuck when they were saying, how do I do a welding project? And so they've put their heads together to really think about how can I do some of these hands-on activities. And for example, you know, I participated as a judge in a virtual hackathon with our, State Chamber of Commerce and others coming together to bring teachers together in various regions in the state to really think about how do we tackle this topic. So a lot of excitement out there, a lot of people thinking about how do we do our business just a little bit differently, knowing what we know now. And I think we're going to see some really great progress going forward.
That's great. I know our time's going to be slipping away here in a few minutes, and so I'm going to get this in now, just in case, because this to me is sort of the most important part of this particular gathering. It's always a little risky giving people advice, and remembering this is live streamed, so essentially you're giving America advice. Tough on a good day. But I really would, and I'm also letting you think about this a little bit while I tee up the question, which is probably already obvious. If you could, give America some advice, and it's okay. You are practitioners. You implement. You're leaders. So your advice is important, no matter what people might think, especially you yourselves. It is important. Tell me what kind of advice you'd give America regarding the reopening of America's schools at all levels.
Yes, let me speak from the higher ed perspective. It's important that we allow the students who need to be there, but that doesn't mean that every administrator or a faculty member who's teaching solely online, or even all of the advisors, if you will, need to be there. Our approach is going to be to keep our density down. And even as a big employer, we employ 7,000 people across the state of Indiana in our cities. If we can work virtually and can do that effectively, which we watched 7,000 of our colleagues do, we should continue to keep that in mind as we plan forward. So my advice is make sure that our students come first, that we allow the square footage, if you will, for our students to be there with the faculty who need to serve them, but in those other ancillary services or people who are overhead, right? If we don't need to be physically present, give that facility, make sure that it's fully leaning towards the student in every case.
Well said. Commissioner?
Okay, I think my advice would be recognizing that we're all in this together. We truly are. It's all hands on deck, and never underestimate the importance of solid relationships. And I know you said you felt your community was never stronger. I feel like that in the education community right now in Missouri, because the power of picking up the phone call and having these regional groups that would call in, the superintendents, that I have 40 teachers on a call tomorrow, the governor walked in the governor's office. We've been in constant contact about how do we solve this dilemma, working very closely with the Department of Health, working very closely with our pediatricians, just really trying to solve this together. But I will tell you, the schools that seemed to struggle the most were the schools that didn't have that built-in relationship with their parents and their families in the start. And those who are doing really well are the ones that had those relationships very much intact. So never underestimate the importance of building and keeping strong relationships. And again, Penny's in the audience here. We're talking about the importance of reaching out to your fellow colleagues across the nation. We're all working to solve these issues. So very important to build your networks and stay connected through this time.
That trust is pivotal. It's amazing. It exists in the medical community. People trust their doctors. People trust their nurses, and they have shined in this environment. And I think largely because people trust them. And I feel the same way about education. People trust their teachers, they trust their school administrators, they trust the people in leadership roles in education because they are literally putting their children in our care every single day. And if that trust is forged in iron, it can go a long, long way to creating something special for students. Madam President.
So a little bit of a dovetail. I would say if you are a school district, engage your constituents, engage everyone, down to the children, the taxpayers who don't have children in the school. They have a say also. It is very important that everybody be a part of the solution. And I really believe that if they have input, even if it doesn't go their way, they do feel a part of the process. And I think some of our best solutions come from comments from parents, a comment from a bus driver, a comment from a child. It is very important to engage those. And then secondly, I would just say to really strategize and really be sure that you have, I look at it as we are planning for the best, hoping for the best, but knowing that the not so best is likely to happen, and having those strategies and knowing what we call tripwires are. What issue or situation will trip the response of a change, so that we can be fluid and not have to just shut everything down and every time that we need to make some kind of an adjustment. So I would just really strategize and talk to each other in your communities, really have an open dialogue.
Thank you, Nancy.
I'd have three. I think I'd look to my mom and her twin, who's 93, who lived through the Depression, multiple wars. Between the two of them, raised 14 kids, and there's that perseverance, faith, and grit that they taught us as kids. And I think that's something that we need to teach our kids today in America. I really believe that. And I think parents need to be advocates to their school districts, to their principals. It doesn't matter if it's Catholic, private, or public, that they want their children back in school. I can't stress that enough. And trust that all of us would not put your children in harm's way. That's something that, I understand everyone is different, but it's so important that you do trust the school and the decisions being made in order to educate your children in a very safe, healthy, and loving environment.
Well said. I would say challenges create opportunities. We have probably never been more challenged in the history of public education, but I think it's an opportunity for us to grow and improve. I would also add, we are a people business, a relationship business. We need to focus on that first. And the best schools and the best school systems, in my experience, are the ones where home, school, and community work together as partners.
Well said. I remember as a little boy, quite a little boy, standing in line with all of my peers at my elementary school, and we would queue up to the front of the line where there would be someone waiting with a white plastic spoon, and on the spoon was a sugar cube, and on the sugar cube there was a pink to red liquid. And we would take it, it tasted very good, and we would move on. That was the polio vaccine, another major health issue that afflicted enormous numbers of America's young people. But I also remember standing in that line, too young to really know about all of this, but knew I trusted the people who were around me. I trusted my teachers. I trusted the family members who came to help with the dispensing of this vaccine. I trusted the people around me. They knew much more than I did, but I also knew they cared much more than anybody could imagine. And going into this next round of educational opportunity for young people in America, it is incumbent that once again we challenge ourselves to make sure we are worthy of that trust, that we do the right things for them and with them, not only to open schools and open them safely, but to make sure that what is on the other side of that is a world-class educational experience that will give them the same opportunities that I was given at that time, and that is simply to grow up and live my little share of the great American dream and know that education is pivotal in making sure that that's the case. I hope you will join me in thanking our wonderful panel members for being with us today. By the way, Governor, she's pretty good. Yeah, she does all right. I know you're here to make sure that's the case, but she does. She's okay. I want to thank the Secretary for giving me the chance to be a small part of this today, but also to help put together the events that we're all enjoying here today and will still continue to enjoy through the rest of the afternoon and find it useful, helpful, and hopeful in the work that we as Americans have to do ahead of us to make sure that we don't take a back seat to anybody in terms of reopening our schools and providing every one of those young people their shot at the great American dream. Thanks for being a part of this session.
Well, thank you very much. It's an honor to be with everybody, and very importantly, we're at the White House, and there's no place like the White House. And for those of you that this is the first time, I know exactly what you're thinking, because I was here a first time, and it was still something I'll never forget. So it's great to have you, and our First Lady and I are pleased to welcome everybody to this wonderful place and discuss the vital importance of safety and reopening America's schools. We want to reopen the schools. Everybody wants it. The moms want it, the dads want it, the kids want it. It's time to do it. You know, our mortality rate is right now at a level that people don't talk about, but it's down tenfold. So you look at deaths are way down from this horrible China virus, and it's a disgrace that it happened. Shouldn't have happened, but it did. And the economy is coming back, and it's coming back strongly. Jobs are setting records. For 2 months ago, they set the record, and then again, almost 5 million new jobs last month, which is a record, and it broke our last record of a month before. So the numbers are happening much faster than anybody anticipated. The stock market, NASDAQ, just hit another record today, and the markets generally are just really a very small amount below where they were at the height of the market when we first had to do this about 4.5, 5 months ago. And it's incredible what's happened. When you look at education, my administration has approved $13 billion for state and local education. We've approved over $6 billion to support colleges and another $6 billion in emergency grants to students, very importantly. We waived standardized testing requirements, deferred federal student loan and interest payments. So you take a look at the student loan program, we've waived student loan and interest payments, and that is something that people haven't been hearing about, and nobody talks about it, but it's a big deal. We've pioneered new treatments that are dramatically improving the health outcomes. Vaccines are doing very well. Therapeutics are doing very well. The therapeutic research has been incredible, and I think you're going to have a lot of big things happening long before the end of the year, both vaccines and therapeutics. Therapeutics is, I guess, a little bit of a word we can use for on the way to a cure, but they make you better. I mean, to me, the therapeutic is even more important than the vaccine at this point because people will get better. But the numbers are, the testing numbers are the highest they've ever been. We're almost up to 40 million in testing, and 40 million people, which is unheard of, far more than any other country, many times what any other country is, and therefore we have more cases. Because we're doing more testing, we have more cases. If we did half the testing, we'd have far fewer cases, but people don't view it that way. What they have to view, though, is if you look at the chart, and maybe Mike has it, but we looked at it before, if you look at the chart of deaths, deaths are way down. So what we want to do is we want to get our schools open. We want to get them open quickly, beautifully in the fall. And as you know, this is a disease. It's a horrible disease, but young people do extraordinarily well. I was with the governor of New Jersey. We were talking, and he said and he mentioned a number which is a very high number, but it's a number nevertheless, thousands of people. There was only one person that died that was under 18 years old in the state of New Jersey, and that was somebody, I guess, had a problem with perhaps diabetes or something else. But one person out of thousands of people, one person died who was under 18 years old. So that's a pretty amazing stat when you think of it. But I'd like to now just give the mic to our First Lady. She's going to say a few words, and then we're going to go with Mike and Karen Pence. And then we'll go around the room a little bit, say a few words. And Kellyanne, you did a great job this morning. Thank you. Really great. So if I might, First Lady, please.
Thank you. Good afternoon, everyone. The first pillar of my Be Best initiative is children well-being and taking care of children's social, emotional, and physical health has never been more important than during the COVID-19 pandemic. The administration has worked around the clock to protect Americans from the coronavirus, but many challenges for children and families can be just as invisible as the virus and just as dangerous. When children are out of school, they are missing more than just time in the classroom. They're missing the laughter of their friends, learning from their teachers, and the joy of recess and play. For children with disabilities, without access to technology, or whose homes are not a safe place, the situation can be even worse. As the start of the school year gets closer, I encourage parents, teachers, and school to teach children about the importance of CDC guidelines and to implement them when appropriate. Children's mental health and social development must be as much of a priority as physical health. The same is true for parents. Many will be forced to make stressful choices between caring for their children and going back to work, and we must address those needs as well as their own mental health and well-being. As we continue to come together as Americans to tackle these challenges, I'm honored that you could all be here today to offer your thoughts. I look forward to working with you to make sure that Americans' children and families can be healthy and thriving. Thank you very much.
Thank you very much. And Governor, thank you. I see you sitting over there. What a job you're doing.
Thank you.
Thank you very much for being here, Governor. Appreciate it.
Proud to be here.
And thank you, Melania, very much. We just heard, Mike was telling me that Governor DeSantis is doing a terrific job. He just announced that the schools will be open in the fall, and we hope that most schools are going to be open. We don't want people to make political statements or do it for political reasons. They think it's going to be good for them politically, so they keep the schools closed. No way. So we're very much going to put pressure on governors and everybody else to open the schools, to get them open. And it's very important. It's very important for our country. It's very important for the well-being of the student and the parents. So we're going to be putting a lot of pressure on open your schools in the fall. Mike, please.
Well, thank you, Mr. President, and thank you for your leadership. I have seen it day in and day out since you asked me to lead the White House Coronavirus Task Force, and today is just one more installment in your commitment to make sure that our states and our families have all the resources they need to meet this moment. Our healthcare workers are provided for, but also understanding that we've got to reopen America and reopen America safely. But we convene all of these great leaders from around the country today, Mr. President, because you know that to open up America again, we need to open up our schools again. And I want to thank all those gathered here for their efforts as well. I know I speak on behalf of my wife, Karen, when I also want to express our profound gratitude to the First Lady throughout this pandemic. Her regard for families, for children, for the emotional impact that this has had on every American is so admirable. And I'd like to invite everyone to show your appreciation for our First Lady and the work she's done for American families. Mr. President, since the moment that we asked the American people to step up, to take efforts to slow the spread, and we, in that 15 days that would become 45 days, we encouraged people to refrain from attending school, if possible, to engage in school from home whenever it was possible. There were two categories of heroes that emerged. One was the parents around America who stepped up as never before. And those that are looking on, those that are represented here should know. Your president, the first family, your vice president, and our second family are grateful for the families of this country and everything you've done to be the teachers for your children, to create the structure at home where they could continue to learn even in a challenging time. I also want to say how grateful we are to the teachers, Mr. President, and I'm actually sitting next to one who I've been married to for 35 years. As you know, she actually teaches in a local school in the Washington area a few days a week, and I watched her go in and pack up crates of art materials that children could come by and pick up and take home to continue their learning. And so I'd like to invite everybody to show your appreciation for the parents and all the great teachers who have done the work of continuing to educate our children throughout this pandemic. It's truly been inspiring. And Mr. President, the American people deserve to know that while we are seeing rising cases across the Sun Belt, at your direction, we're ensuring that states have the resources, the support, the supplies, and personnel that are actually arriving as we speak in states like Texas and Florida and elsewhere to relieve healthcare workers. And to your point, I hope the American people appreciate the point that you made yesterday on the national stage and did so again today, that because of what our healthcare workers have done, because of the innovation and the medicines that we've been able to make available, literally we have seen fatalities decline by 90% from some of the worst moments of this pandemic. And we're going to continue to work each and every day to continue to keep those losses low and steady. We're going to save lives as we reopen our country. Today, Mr. President, as you know, we spoke to the nation's governor on the topic of this summit. We reflected on the fact, as now 47 governors and the governors of 2 territories have announced plans to reopen schools across America, that it's important to do so for a variety of reasons. The First Lady just spoke of this. We ought to well be concerned about children falling behind academically, and there's no substitute for in-classroom learning, for in-person learning, and that's been much discussed at the summit today. But as the American Academy of Pediatrics, so well represented here today, recently reflected, there are social costs, emotional costs, and even physical costs to our children across this country that we spoke of the governors today. It's important that we reopen our schools, as you've directed, for the academic and the intellectual development of our children, but it's also vitally important that we remember, as Dr. McCants-Katz told the governors today, that 7 million American children suffer from either mental illness or emotional disturbance, and they principally receive the care from health and mental services at their school. And so making sure that we're meeting the mental and emotional needs of our children, as well as making advances academically, is what brings us here today. The last thing I'll say to all those gathered here, Mr. President, is from early on, you have directed our task force and the CDC to equip families and schools and states with the resources to operate. It was as early as March 12th that CDC issued its first guidance for strategies for school and child care services. We issued decision trees in the middle of May, and just last week, I'm pleased to report the CDC published new guidance for K-12 schools and higher education regarding the type of testing that is appropriate and other strategies. Mr. President, we can bring our schools back. And next week, the CDC is going to issue 5 new documents, how to prepare communities to return safely, decision-making tools for parents and caregivers, symptom screening, cloth face coverings in school settings, guidance, and the rest. We're going to continue to flow these resources and this guidance, but as Dr. Redfield told all the nation's governors today, and I want to acknowledge Governor Parsons' leadership and his presence here today, we're truly grateful, is that what you've instructed our task force to do and the CDC to do in this moment is to say to states around the country and to local communities, we're here to help. The CDC has issued guidance, but that guidance is meant to supplement and not replace state, local, territorial, or tribal guidance. In a word, Mr. President, you've made it clear to us, we don't want to be the reason any school doesn't reopen. And so our word to the parents that are looking on, to teachers that are looking on, administrators, leaders in your community, is that we are ready to work with the leaders in your school system and in your state to find a safe and responsible way to reopen your schools. That's our commitment. Mr. President, we're continuing to move out on that, on the belief that to open up America again, we've got to open up America's schools. And the American people are taking important steps every day, including this summit today, to do just that. And I'm truly grateful for all of those represented here for being a part of this important work. With that, I'd be happy to recognize Mrs. Pence for a few comments.
Thank you, Mr. President. Thank you, Mike, and Melania. I had the privilege of addressing this group earlier today and kind of opening up your summit. But I do want to say thank you to all the teachers. I know at my school, everybody quickly learned how to do online teaching. It wasn't something that our teachers across America were familiar with, and I just applaud them. They have worked so hard. And the parents really are the unsung heroes. They really had to quickly get up to speed, and it was not easy to do. But you know, our kids are struggling, and they need their friends, and they need their teachers, and they need their routines. This decision to open up the schools greatly impacts our children. It impacts them academically, it impacts them socially, and it impacts them emotionally. So I applaud what you're doing here today, Mr. President, because our kids, for their mental health and their academic health, they need to be back in school. So thank you.
Well, thank you very much, Karen. I appreciate it. And I see Dr. Redfield over in the audience, and I appreciate it. And I know you'd like to see everybody coming back and getting back to school in the fall. And I've read everything you've written, and I appreciate that very much, Doctor. Thank you very much. Appreciate it. Governor, please. Thought maybe we'll go around the room real quickly. We'll go quickly, and we'll get everybody to say a few words, and we'll start with our governor.
Thank you, Mr. President. As you said when you come here, I'm just honored and humbled to be here, sitting with you, the Vice President, the First Lady, and the Second Lady.
It's our honor.
Those dreams you think about someday, never imagine them being reality, but here we are. And so it's an honor to be here today. Let me first start off by just saying thanks to the President, the Vice President, for what they've done over the last, well, since they've been in office, to say the least. But over the last 17, 18 weeks, they've been on the phone every week. The President himself has been. And I don't mean for 5 minutes to say hello, governors, and see you later. In-depth conversation with governors across this state. The Vice President has been there for almost 17 to 18 weeks. I know that I've been following with them. And the one thing they've stressed every day in those phone calls, every week, they're trying to do the best thing for this country and for the everyday people out there, and they were trying to make their full support to the governors across this state. And I just want to thank you for doing that.
Thank you.
For leading as what good leaders do in times of crisis. And I just want to thank you for that. When the president said he was going to put a little pressure on governors to open these schools up, I will tell you this, on a few phone calls I've had with him, he can put a little pressure on you if he decides to do that. I will say that on that. So sometimes we all need a little push to get things going. What the First Lady said when she talked about the kids was so important to me as a grandparent, as a father. I sit there and I think of all the kids that need to be in school. There's the ones that have the privilege of going every day. That's almost common that we go to school for most of the school kids, but a lot of school kids, it's a safety blanket. It's a way to get nutrition. It's a way to get counseling. It's a way for somebody to help them when they cry out for help. And that's also why getting schools back open is so important. And then if you want to take that one step further, it's about making sure people are going to be qualified for the workforce of tomorrow. This virus cannot shut our country down or our states down. We have to deal with it as we would anything else that we've dealt with in this country, and we have to move forward. And economy and life goes on, and education is part of who we are, and kids need to get back in school. Parents need to get more involved in their schools and be back involved in their schools. As I heard speakers today speak, it's part of who we are. It's how we build a future, and I think that's so important. I also want to thank the Second Lady for giving me a little inspiration on a couple of key bills we signed in Missouri, and I want to give you a little credit today. We did full reciprocity in the state of Missouri yesterday. I signed that bill, and full military reciprocity, and the Second Lady kind of gave me a little inspiration for that. And also my daughter's a school teacher. To do that, most of the time we have a father-daughter relationship, except when it comes to teaching, and she becomes a senior advisor to the governor when we talk about those issues on that. But again, I just want to thank the President for his support for our state. People appreciate it, Mr. President. I want you to know that, for the First Lady and for where we're headed in this country, because we've went through hard times before, and we'll continue to get through hard times, and we'll be better off for it, and we'll be stronger than ever, so thank you.
And you won't be changing the name St. Louis, will you?
No, we will not be doing.
Thank you. Thank you very much. That's very important. Thank you very much. Please.
Good afternoon, Mr. President. I'm delighted to join you, the First Lady, the Vice President, and the Second Lady here today to talk about why it's important for children to be in school. My name is Dr. Sally Goza. I'm a pediatrician from Georgia, and I'm president of the American Academy of Pediatrics. Children get much more than an education at school. Being away from peers, teachers, and school services has lasting effects for children. Although this will not be easy, pediatricians strongly advocate that we start with the goal of having students physically present in school this fall. Of course, returning to school must be done safely. We must take measures to keep students, teachers, and staff safe and with flexibility to adapt as needed to the community's prevalence of COVID-19. The evidence we have so far indicates that children are less likely to have symptoms or severe disease resulting from coronavirus. Children are less likely to become infected, and they are less likely to spread infection. We know, however, that missing school can have serious consequences for child health and well-being, particularly for students with disabilities or with special health care needs. Students who are in school learn more than reading, writing, and arithmetic. They also learn social and emotional skills, get healthy meals and exercise, and mental health support. Schools help identify and address learning deficits, physical abuse, substance use, depression, and suicidal ideation. These are all critical reasons to get children back to school. Reopening schools in a way that maximizes safety, learning, and the well-being of children will clearly require new investments in our schools. We urge you to ensure that schools receive the resources necessary so that funding does not stand in the way of keeping our children safe or present at school. Thank you, Mr. President. We look forward to working with you and all the people around this room.
Thank you very much. Please.
Thank you, Mr. President. Penny Schwinn from the great state of Tennessee. Appreciate the invitation on behalf of our superintendents, our districts, our families, our teachers, and our public officials. Opening up Tennessee, we know that reopening schools reopens our economy. We've got great examples of where superintendents have come together and thought through scheduling to make sure that parents can get back to work for companies who support multiple regions. We've done an incredible job with resources, 20-plus toolkits. We've opened up free professional development for teachers and principals for free statewide and online tools. And I'd also like to just thank the First Lady for her support on child well-being. We had a wonderful conversation a couple of weeks ago on the task force that we've launched statewide, covering the entire state and making sure that all of our children receive a high-quality public education, as well as being served in terms of nutrition, transportation, et cetera. And I'll just end by saying, as the proud daughter of a police officer and a teacher, I was raised with safety and high-quality education being two fundamentals in my home. And it's a great honor to be able to reinforce that with the schools in Tennessee today.
Thank you very much.
Thank you, sir.
Great. Thank you. Alex?
Well, thank you, Mr. President. Really, thanks to the historic response that the President has led to this unprecedented pandemic, we have the tools where we can reopen our workplace. We can reopen our schools, and we can reopen healthcare. We've got the tools. When we think about kids and schools, the school for our children is a center of so much of their life. It is where they get health care. It is where they get mental health care. It is where many of them get nutrition. It is where mandatory reporting of child abuse and sexual abuse happens most often because of the nature of mandatory reporting requirements. In addition to the social, physical, intellectual development that the kids need from a physical setting in schools. We're in a very different place now than we were 2 or 3 months ago. We have the world's most robust testing system with close to 40 million tests having been done. We have health system capacity and personal protective equipment to enable us to work through these outbreaks that we've got. We're advancing on therapeutics, as the President said. We now have remdesivir for hospitalized patients, steroids for lung illness. We have convalescent plasma to treat individuals. And just this morning, the President made a major $500 million investment in a monoclonal antibody that will be a treatment that could, if successful and if approved, could deliver hundreds of thousands of doses as early as late summer, early fall. We have 3 vaccine candidates, and just this morning invested $1.6 billion in a 4th vaccine candidate that could deliver hundreds of millions of doses this fall and into early next year. So it's just a very different circumstance than we ever had before. We know more about this virus. The fatality rate is going down because we're better at taking care of patients with the virus. Our fatality case rate in the United States is among the lowest, if not the lowest, in the developed world right now. And we can reopen our schools safely with what we know. And it's really simple practices of common sense. It's social distancing. It's wearing face coverings when you're in a setting that you can't social distance. And it's practicing good personal hygiene. The tools are there to bring our kids back safely, to protect our teachers and our staff. And it's time to do it now.
Thank you, Alex. Good luck with all of the therapeutics. I know you're getting very close, very close. That would be incredible. What are your chances early, like in September?
So Regeneron, which is the one that we funded at almost $500 million this morning, they are one of the most advanced. We have several very advanced monoclonal antibody products. This basically takes that convalescent plasma that recovered patients would donate and bioengineers that in effectively unlimited supply that we can do. And so it's a cocktail of multiple antibodies that give your immune system an immediate defense. And we're studying it both for preventing disease as well as stopping the progression of the disease. So it's really very exciting.
And that seems to be just working. It's basically, it's sort of the ABCs of what we're doing. It seems to be working. Do you have tests right now that say it does work?
Well, you've got the initial trial work that Regeneron did, and that's why we're investing in the late stage development of it. But then we have these other 3 therapies that, thanks to your leadership, we have so many more tools than we had 3 months ago in terms of therapeutics. So we don't want anyone to get sick, but we have much better ways to take care of individuals now than we did 3 months ago.
Okay, that's exciting, very exciting. All right, we'll hold you to it, September. You too, Doctor. You too, Doctor. Please, thank you.
Good afternoon, Mr. President. I'm Patrick Daly, the principal of St. Vincent de Paul High School in Petaluma, California. We're in Sonoma County. I just want to tell you what an honor this is to be here this afternoon. I want to thank you, thank the First Lady, Vice President Pence, and the Second Lady for your leadership of our country. Really, during a very difficult time, for the First Lady's love and protection of children, very important to me. And being a father of 4 kids, three 3 daughters and a son, it is very important. We plan an opening April 10th. That is our focus. I think that we have put a plan together that is a working document with all the safety precautions and policies in place to ensure that St. Vincent de Paul opens following all the guidelines that are recommended. I think that, as you stated earlier, this should never be political, and I think at times it has become very political in many school systems throughout our United States, and I think probably particularly in California. So we were very excited about the possibilities of the fall, and we have 3 plans. One would be the reopening, which we plan August 10th, and then a hybrid plan, which is 2 days on, 1 day off, 2 days back in. And then, as I mentioned earlier, God forbid if we had to go back to the distance learning. I just don't think it's beneficial to boys and girls 14 to 18 years of age. And particularly, I really feel for the parents of elementary school children who are trying to work and provide for their families, and at the same time having to stay at home and teach. It's very difficult, and I hear that a lot from our own elementary school. But I can't thank you enough for your leadership of our country, and thank you for this honor.
Well, good luck with your plan and getting them open, and hopefully you can do 5 days instead of the 2 and back and forth. I know you want to be able to do that, so you'll try. Thank you very much. Great job. Please,
Hello,
good-looking person this is, huh?
There we go. Hello, Mr. President. I'm a student at St. Vincent de Paul High School. My name's Cameron Vaughn. And I personally just want to thank you for both inviting me and helping to reopen schools. Coming on behalf of the students, it really means a lot just to be able to get back out, and it means a lot to our emotional health and our mental health just to be out there with our friends, because a lot of us don't have that opportunity. And it helps reopen our schedules, so we have something to look forward to. Me, I'm a person of schedules. I can run by a schedule, make a schedule for myself. So I just want to thank you very much for getting us back to that.
Great job, really great. Thank you very much. We'll get you back, okay? We'll get you back soon. Thank you. Kellyanne, please.
Mr. President, Mrs. Trump, Mr. Vice President, Mrs. Pence, thank you very much. I listened to Cameron Vaughn, and I'm reminded why we're here in this room today on this very important topic, but why we're here in this administration. I believe a hallmark of the Trump-Pence administration has been the success in looking out for and expanding opportunities, safety, and well-being for the forgotten child. And the forgotten child took on a new meaning during this global pandemic. Between the 1st and 3rd weeks of March of this year, just about 100% of our school children across this country, of all ages, were taken out of their schools and stuck at home. We saw a few things happen, many of which have been spoken about today, but I'll add one more. The digital divide was laid bare in that so many of our students could not access basic digital assets to allow them to confidently and competently complete their schoolwork and to learn and to thrive. The schools are our central nervous system because our students are the heart and soul of our nation. And so today your message is, Mr. President, Mr. Vice President, that all children matter. And our mission is to make sure that all children can safely and securely re-enter their places of learning very soon. This has also impacted our economy, and I have a soft spot for single moms, having been raised by one, and our single moms have been disproportionately impacted through their job security, their wage earning, and most of them are not in jobs for which they can telecommute. So we're creating pandemics within this pandemic. The good news is that our children are at low risk for transmission, even as they are at high risk for maladies, visible and invisible. The great news is that as we safely reopen our schools, we are in keeping with so much of your agenda, Mr. President, Mr. Vice President, Mrs. Trump, and Mrs. Pence, which is to preserve and expand educational opportunities to respect the dignity of all students, but to respond to the individual needs of all of those students by expanding school choice and charters and educational freedom and opportunity scholarships, allowing them to have more options as they go through their lives, beginning with a quality and solid education. The President has said, if we as a nation can win 2 world wars, dig out the Panama Canal, put put a man on the moon, we certainly ought to be able to deliver a quality education to each child. And that begins with reopening our schools and making good on that promise to each and every one of them. Thank you very much.
Thank you. Thank you very much, Kellyanne.
Hi, Mr. President. I'm Jenny Beth Martin with Tea Party Patriots. Thank you, and thank you, Mrs. Trump and Mr. Vice President and Mrs. Pence for having me here today. While I am with Tea Party Patriots, I'm also a mom, and my children are sitting right over there, so thank you for having us here today. Mr. President, you are right, and I hope you will trust your instincts. America is not meant to be shut down, and we have to reopen schools this fall. I've been in touch with almost 1,000 doctors from around the country. I helped Dr. Simone Gold spearhead a letter to you signed by 800 physicians and surgeons who talked about the side effects of the lockdowns. I've done a second letter with over 150 doctors, 240 nurses, 330 educators, 70 national groups, and thousands of parents and concerned Americans who want to see schools reopened. Reopening schools is going to stabilize our society. I think it's the number one most important thing we can do to stabilize our society from top to bottom. Whether it is in a local community, just reestablishing calendars, which churches, nonprofit groups, traffic patterns, people who don't have children care about the calendar for schools. Kindergartners and elementary school students simply cannot learn looking at a Zoom screen. If they could, we wouldn't need schools in the first place. We could just plop them in front of a television. The last place in the world a middle school student needs to be is online, unsupervised by adults. They bully each other when they're in front of teachers. You can't even imagine what's going on with social media right now. Young adults and high school students are losing hope and optimism for the future. And in February, they had so much. And now we turn on the television and we can see the destruction that lack of hope and optimism is causing. Employers have to rebuild their companies. They need employees at 110% to be able to do that. We did everything we could to flatten this curve, and we have to roll up our sleeves now and rebuild our companies. But we can't do that when employees are dividing their time between taking care of their children indefinitely for who knows how long, and trying to get their job done. I have one employee who has 5 children. His wife is a dental hygienist. I'm granting him as much grace as I possibly can, which is easy to do. He's a wonderful employee, but I can't even imagine what it would be like to have 5 children and all of a sudden have to homeschool them all. And it's not even homeschooling, it's helping them with digital learning. Homeschool parents have asked that we're careful about not conflating the two. For me, I'm a single mom now. In 2007, 8, and 9, I went through financial crisis. My then husband's business failed. We lost our house, we lost our cars, we lost everything. I cleaned houses to help make ends meet. I've done everything possible to rebuild. I know what those families who are now unemployed are facing. Trying to divide their time between taking care of their children, not knowing if their children are going to be educated, and figuring out what they're going to do with their life is the hardest. It's incredibly difficult. And for people who think, oh, we can just work at home, or we're essential, you're an essential employee, it sends the wrong message. Every single person in this country is essential. We are the United States of America. Every one of us is essential. Every one of us is important. And not every single family can afford a computer so that their children can be online at the same time, or Wi-Fi, as Kellyanne was just talking about, to be able to do Zoom all at the same time. So families are suffering, and the education is suffering as well. And as a single mom, this situation is ripping me in two. You cannot be in two places at once, physically or mentally. And I'm doing the very best I can to take care of my children. Their father, when they're living with their father, he does a great job taking care of them. But when they're with me, I'm doing everything I can to take care of them, help them prepare for their senior year of high school, make up prom, dealing with whatever else we have to deal with from the shutdowns, and run a company and work. And it's impossible. It's impossible to do what we need to do. So the schools must be reopened. It will stabilize our country. I cannot thank you enough for doing this today and sending this message. And the doctors who I've been working with, they want to do anything they can to help calm the fear that is permeating our country. They understand we have to have a healthy respect for the virus, and we have to be able to live our lives. And they and I will do anything we can to help you with that. Thank you very much.
Great job. It looks like you're doing a good job. Is your mother doing a good job? She good, right? You said the right thing. Okay, great job. Thank you very much.
Mr. President, First Lady, Mr. Vice President, Second Lady, on behalf of the great state of Tennessee and Governor Bill Lee, I want to thank you for all of the help and resources and support that you and your administration have provided us. You guys have been accessible, you've been responsible, and that means the world to us in the states when we're trying to do our jobs. I'm Dr. Lisa Piercy. I'm the Commissioner of the Tennessee Department of Health. I'm also a pediatrician and a mother of 4. And I know very clearly that education and economic prosperity are key drivers of health. We know in Tennessee that kids have to get back to school and parents have to get back to work. It's paramount for our economy and it's paramount for the health of our nation. And we're doing our part in Tennessee for that effort. And thank you again.
Yeah, thank you, and say hello to Bill, please. Thank you. Doctor?
Thank you, Mr. President, First Lady, Vice President, Second Lady. I want to really, today was a really terrific day because it took Americans' children, put them in the center, and said this is not going to be a unilateral and a unifocal, one-dimensional discussion about COVID-19, but a discussion that transcended that single moment and brought in the other issues of mental health, academic health, emotional health, and really said that it's important to the whole child to have the availability of schooling. And I think having that discussion that was multidimensional, having teachers here and students here and the health commissioners here and the secretaries here was really very helpful because I think it not only put the child at the center, but also made it clear about how important these other issues are that are beyond COVID-19 in the health and welfare of our children. And so the discussion was terrific, and I think we have a way forward.
Thank you very much. Thanks, Tim.
Thank you, Mr. President, so much for including me in today's event. I think I'm on now. Thank you for including me so much in today's event. I want to thank you. I want to thank the Vice President, the First Lady, and the Second Lady for your comments and for all the concern you've had for the education of our children. I come today as a parent, as an OBGYN physician, and as the managing partner of my practice. This has been a very scary, but also a very enlightening experience to have walked through. It's been quite the challenge, and I will say quite the challenge. But the first thing I want to say is it's so important to get our children back in school. Our higher education students, our high school students, and our middle school students are so embedded in social media already. What they need is that social interaction with each other and with adults, because without that, I fear what our society is going to look like. The preservation of society is reliant upon the interaction of these children day to day, face to face with each other. I also saw the anxiety of my youngest child, who's here today with me, Macy, back on that side. I saw her anxiety when she came home from college, the anxiety of not knowing how her education would continue, of then trying to set up the Zoom meetings and make it happen, but more importantly, not having the opportunity for those in-person tutorials or that in-personal relationship with a professor to complete her courses. And I think her courses did suffer because of it. She's a good student and it wasn't dramatic, but I can only imagine what it was like for other students. My eldest child had a learning disability, to try to bring him home and do this education online without that in-person benefit, without the tutors being there present, would have been a disaster to his now very good career in Richmond. And I just fear for that student especially. As we go back to school, I think it's very important that we also educate these kids, because they sometimes do rise above it and feel as though they don't have the mortality or the morbidities or that problem of interaction with each other. They will have new family units. My daughter will be in an apartment with 3 other girls. They will be the new family unit. And it's important that we educate them for that, for when they come home, that they realize that their elders, their grandparents, and all are now vulnerable to them. That family unit has changed. But we can do this, and we can teach them. And masking, they've learned this. It's important, but we have to reinforce this at the college level to keep it ongoing as a priority. And I know that we can do it. The other thing that I, as a physician, am a strong believer in is herd immunity. And what I'm not proposing is that we put all of our students in a big vat and only the survival of the fittest come out antibody positive. I'm not saying that. I do think it's important to stop this tremendous isolation that keeps the virus as the winner. We need to get out. We need to have the vaccines to help us. We need to have the interaction that helps to get that immunity so that we can protect our vulnerable, and we can protect our elderly, and we can protect those younger folks with comorbidities, because we've got a society that is immune to the virus, and we can put the virus back in its place. And finally, I just want to, again, thank you for being here. Thank you for hearing me out. And thank you for putting education of our children in the utmost, and for putting our economy in that place too, because as a business owner, when I have parents who have to come late or leave early in order to educate their children and yet run a business at the same time, as this lady stated, it is incredibly difficult, if not impossible. And we want to maintain their jobs. We want to maintain their work ethic, but we also want to maintain the intelligence of their children and of our future. And so I thank you again for your interest in this and for letting us be here. Thank you.
I think it's very important to note that we've done it right. We closed up. We were amazing the way our great citizens adhered to what we wanted to do, and we saved, I think, millions of lives. Now we want to be open. We understand the disease much better. Nobody knew what this was. Nobody had ever seen it before. There's been nothing like this since 1917. That's more than 100 years ago. But we saved tens of thousands of lives, hundreds of thousands of lives. And now we're open, and we want to stay open, and we will stay open. We're not closing. We'll put out the fires as they come out. I call them embers and fires and whatever you want to call them, but I think it's very important to note what we've done. We've saved literally hundreds of thousands of lives. I was going over numbers before with the Vice President, and if you looked at 1 million, 2 million, 2.5 million, those are all reasonable numbers to what we could have had. Right now, we're at a number, as you know, far lower than that. And where would you say we are today, Mike? 130,000. About 130. So we're at 130, and we could be at way over 1 million right now, and I think it could have been 2.5 or 3 million people. So, but now we're open, and now we understand the vulnerable. We understand who has the biggest problem with it, and we watch that group and that age group, and also people that aren't feeling so well with respect to, in particular, Deborah, certain diseases. The diabetes is bad, the heart is bad, and we watch very closely, and we've done it right. When you look at what happened with Sweden, I kept hearing about Sweden with the herd, you know, with the pure herd. The herd concept of opening up and keeping open, all of a sudden it exploded. You look at what's going on in Brazil and a couple of other places. So we've really done it right, but now it's time to be open. It's time to stay open, and we will put out the fires as they come up, but we have to open our schools. It's so important to open our schools. And what you said from a psychological standpoint with respect to staying home any longer, you can't do it. You can't do it. That has great dangers also. So that's where we are. We're not closing. We'll never close. You'll have certain areas that will have difficulty, and they'll do what they have to do, and that'll be up largely to the governors, but it's also, they're in very strong consultation with us. We're supplying them with tremendous materials and gowns and masks and anything else they need, and they should be doing it themselves, but we've made a lot of governors look very, very good. We've made a lot of governors look very smart that weren't so smart, and some have just done a good job right from the beginning. I could give you a list. I could grade them. I could grade them out from 1 to 50, and you'd be amazed. You might be surprised at some of them, both good and bad. But I thank you very much for your remarks. I think it's very important. What you said, I think, is very important. Please.
Mr. President, First Lady, Mr. Vice President, Karen, it's great to be here and to represent the great state of Indiana as president of Ivy Tech Community College. We are Indiana's community college, so 160,000 students across our great state. And I just maybe want to remind you, as we talk about higher education, the true workforce engine that community colleges are for our nation and how important they are, and the students that we serve. So let me just speak a little bit. We don't serve as much the 16 or 18-year-old, though we have many traditional students. It's often the single mother that we heard about, 29, 30-year-olds and beyond, coming back part-time, and how important it is that they have access to community college. They're also typically the lower income. Our first-generation students are students of color, those that really do need to have the opportunity for the American dream. So this has been incredibly important that we continue to run. And so we have. We've been virtual. We were virtual this summer, and as of Monday, Vice President, we are doing completion academies on campus to ensure that those nurses and welders and all that need the hands-on and labs courses, that they can be out there joining America's new jobs that are coming and being part of a strong economy. So we've appreciated the great support, the CARES Act, all that's gone on. We will operate. We will be face-to-face. We will be hybrid, we will be online, we will be virtual, and for our single moms, we'll even be learn anywhere, which means that they can decide week to week if they can come on campus or be virtual or be asynchronous. So we know we have to change to meet the needs, but we appreciate the great support of this administration.
Thank you.
And we will continue to work on behalf of ensuring that this economy has the workforce and success that it needs going forward.
Thank you very much. Thank you.
Thank you, Mr. President. I'm Fess St. John. I'm the Chancellor of the University of Alabama system, which includes the University of Alabama,
Good.
UAB, UAH, and the Academic Medical Center at UAB. It's an honor to be here. Appreciate your hosting this. When this pandemic started and we had to send all of our students home from our universities, many of us were afraid that this would be the disruption of higher education for all time, that they would learn that they could learn as well on their computer from home as they would on their campuses. One thing this has taught us is we're not worried about that anymore.
Right.
Our students are yearning to come back to campus. They want to be there. It has reaffirmed the value of on-campus instruction at our institutions of higher learning. So last month, our Board of Trustees committed to returning this fall
Good.
on all 3 of our campuses to in-person instruction, realizing that we could not eliminate all risk, but that we can reduce risk and manage risk in a way that allows us to go forward. So early on, we looked to the medical experts at UAB, the researchers and scientists and doctors there, to try to come up with a plan to make our campuses as safe as possible and as safe as any in the country. And we've got a four-part pillared program that allows us to do that. The first, and we believe this is important, is to try to have all of our students tested before they return to campus.
Right.
Not after they return, but before they return, so that those who need isolation can do that at home and we can begin the school year. Second, our UAB folks and our people on all 3 of our campuses have developed a symptom tracking app that's used on the phone. It takes 20 seconds to sign up for and 10 seconds every 2 or 3 days to follow up on, to track symptoms. We also have a program to trace contacts that will allow us to manage student outbreaks during the year. And then last, a sentinel testing or a sample testing program throughout the rest of the school year. What this does is not only, we hope, allow us to reopen our schools, but to keep them open, which is going to be the hardest part. I want to thank you and the Vice President for the assistance that we have received through these federal programs. Without those, it would have been very difficult for our medical center to continue, for our campuses to make it through these difficult times, and to allow us to have testing in place for our students this fall. So we promise to do our best to provide this essential service to our students and our citizens, and we greatly appreciate the assistance that you've given us.
Well, thank you very much. It's a great place, a great state, and you're right about one thing. There's nothing like the campus. If we've learned anything, it's the computer will never replace the campus. They thought it would for a while, didn't they? But it didn't. After about 2 weeks, we figured out that it's much better to have it the old-fashioned way, right?
Yes.
That's great. Great statement, actually. Thank you.
Thank you, Thank you, Mr. President, Mrs. Trump, Mr. Vice President, and Mrs. Pence. I'm a third-grade teacher at Blessed Sacrament Catholic School right here in Washington. I believe, Mr. Vice President, you mentioned some heroes shortly ago. I certainly agree with you. The parents, I couldn't have done this for the past few months at home without the community of parents that we have at Blessed Sacrament School. And I guess the teachers are heroes in their own way. I really believe that the real heroes here are the students that plugged along, that rose to the occasion. In fact, one of my students is here today. Lily, stand up. And that's why I'm here. They showed incredible resilience and spirit, and all of the gifts that God has given them. I really believe that the children are our future, as I know that you do. And I think that they are what is truly going to make America great again. So I want them to be back in school in the fall. Thank you.
Great. We agree. Thank you. Please.
Mr. Trump, Mr. President, and First Lady, Vice President Pence and Mrs. Pence. First, I just would like you to know that I personally pray for you daily, all four of you. I cannot imagine the burdens on your shoulders. And I know that it's only through God that you can handle that. And
It's not easy. I can tell.
I so appreciate
Thank you. That's very nice
all
of
that
you.
you've done. I am the president of our school board in the great state of Ohio, in Cincinnati, Indian Hill, and we are very actively working to get our children back in school full-time, all together, as safe as possible. We are fortunate that we have a lot of resources and we're able to do that. My biggest concern, and I hope through your leadership, we will not have overregulation at the local level that would keep us from being able to accomplish that goal. My biggest fear is that we will get everybody back, we'll get into a routine, and then because of regulations and mandates that we would have to close back down or to send children home, and that is a very big concern. That would be just such a disruption on top of a disruption. So that is probably my biggest concern. I'm also very happy to hear that University of Alabama has made the statement to go back to school. I have 2 college athletes, and we've been waiting all summer to know what's happening at that higher education level, and it's disruptive. They're going into their senior years, and internships were canceled, and it's a scary time. That's a scary time anyway on a good day for a young person. So I really hope that our higher education institutes will make some decisions soon. And really, I'm just honored to be here. I appreciate so much what all of you have done. And however we can help, please don't ever hesitate to
Thank you
reach out.
very much. And will Alabama be playing some great football? What's going on with Alabama?
Mr. President, that's not the first time we've heard that question, I can promise you. We are planning to play the season at the University of Alabama.
Good.
Understand that that creates great difficulties and complexities, and we're hoping for that. It's important to a lot of people, but we're doing our best on that one, too.
It's true. And say hello to the coach. Great coach.
Yes, sir. Thank you.
Mr. President, well, I don't know about Alabama, but the University of Miami is going to be playing. The U's in the house. Yes, it's a hurricane in the building. I'm Johnny Taylor, as you know, and I'm your appointee, and I want to start by saying thank you. I remember being right across the hallway in 2017 when you appointed me to be your advisor, the chairman of the President's Board of Advisors on Historically Black Colleges and Universities, HBCUs. And frankly, there were people who questioned whether or not anything would really come of that, and if you were really committed. I remembered visiting with the Vice President in the room just across the hall, actually, and you met with 60, almost 70 of our historically black colleges and university presidents. They came to visit, and you all welcomed us. I remember meeting with Secretary DeVos early on, and there was all of this commitment to HBCUs, and frankly, the naysayers didn't think you would make good on it, the three of you, and you did. So let me start by thanking you for remaining committed to the country's 101 historically black colleges and universities, and allowing me to be the chairman of the board that advises you all collectively on HBCUs. So thank you. Listen, you've done great by us so far. I mean, since 2017, every year our budgets have increased, but not just financially, but the true support of our institutions. And this today is yet another example of your advocacy, your support of historically black colleges and universities that is giving us the safe space to return safely to campus. We need to bring our students back because, frankly, without these institutions, these great institutions, many of our communities, our fragile communities, will suffer in ways that people just can't quite put their arms around. There are three things that I will point out very quickly. First of all, online education, the virtual education, while it's wonderful, it's not as good as the in-person education in the higher education space. And our students, many of them who come from the most fragile of communities, and many of them didn't get high-quality secondary educations. When they get to the post-secondary space, they need their teachers. They need to look across. They need to come to office hours. They need the assistance. And so we need to encourage these colleges to open so that their students can get the best education and truly experience the American dream. Secondly, HBCUs are economic drivers in many of their communities. In many of these communities, they are the largest employer. And you were kind enough to create opportunity zones, but you know, when the schools are shut down, there's not much opportunity going on. So we need these schools to be open, Mr. Vice President, Mr. President, Secretary DeVos, so that we can get the surrounding community can go back to work. A lot of those businesses are struggling if we shut these campuses down, and they've been struggling for a significant period of time. So it's also just smart business. Small businesses need this. And then finally, the entire country right now is engaged in a discussion around racial tension and the need for diversity. And corporate America in particular wants us to do something about it. Well, HBCUs play an outsized role in helping solve for that problem. Historically, we've created disproportionately black leaders, teachers, doctors, lawyers, judges, et cetera, far more than the 101 schools should be punching. They're actually punching above their weight. And therefore, if we're going to commit long-term to addressing the racial inequities and issues of discrimination in our country, HBCUs have to be a part of that. And you do that by getting these kids and these faculty members and these administrators back to work. So on behalf of the country's 101 HBCUs, as an American, as a father of a 10-year-old little girl, thank you for the commitment to get our schools back and our children back safely so that they can learn and, as I said, experience the American dream. Thank you.
Thank you, Johnny, and you're doing a great job. The only thing is I don't think people know how much we've done for historically black colleges and universities. Nobody knows that we've done more than any administration in history. And nobody knows that, but maybe they'll find out eventually. They'll find out. But thank you very much. Appreciate it. Please.
I'm Brad Weller from Shippensburg, Pennsylvania, 7th grade science teacher. Thank you very much, President, for being here and doing all this. First Lady, Mr. Pence, and I really, really want to thank Karen Pence for stealing all of my information I had written down this morning, and then she did it again after I wrote new stuff down just here this afternoon. So, appreciate it. No, I'm going to keep this short and sweet. We're ready to go back. We literally are ready to go back. I know our students, I know I have 3 kids at home, they want to go back. It's time. It's time, just like your economy, which is the greatest economy ever in the history of the world. I appreciate that. You had to slow it down. The momentum was gone. We did the same thing to our students last year. Their momentum was, I mean, they were rolling. They were a well-oiled machine. And then all of a sudden, just you had to throw it in park. If we just have to change gears a little bit this year, that's one thing we can do. But to throw it in park again, I don't like that option.
Thank you. You're right. Thank you very much. Brooke?
Thank you, Mr. President. I'm Brooke Rollins, the President's Domestic Policy Chief, and while I sit here and listen to everyone, I'm struck. I don't know that the world understands, but I think it's so important. We have a president who was arguably one of the most successful businessmen in the history of our country, the First Lady who has spent her time and her talent and her extraordinary skill on focusing on the well-being of children. We have a Vice President who was one of the most successful governors in the history of our country, and we have a Second Lady who has a career and is focused on being a teacher and an educator. This is the dream team. I don't know that there will ever be another leadership team like the 4 of you to lead this country back to even greater heights than it was ever before. In March of this year, 75 million students' lives and their families' lives were upended when they were sent home. 75 million plus families. Just a couple of months later, here we are in the East Room of the White House with some of the country's greatest educators, leaders, teachers, HBCU leaders coming together to figure out how to get these schools reopened, how to do it in a safe way, and how to do it where we put children first. The good news, and I'm so glad that Dr. Goza is here from the American Pediatric Society Association, because we are now understanding that I think an analysis of 45 studies recently showed that the preponderance of evidence indicates that children are less likely to be symptomatic, have the severe disease, or be really susceptible and transmit COVID-19. And for the week ending June 27th, school-age children accounted for only 1.3% of COVID-19 related hospitalizations. The evidence is showing that it really is time for these kids to get back to school, but it really is about the mental health, the well-being, and the emotional well-being of these kids, but also focusing on, as this president has done, this is the last thing I'll say, the forgotten Americans, the vulnerable Americans who are most susceptible to the ravages of what happens when we don't get kids back to school and we don't get kids and lives back to normal. As the mother of a 5th grader, 7th grader, 8th grader, and 10th grader, there is no doubt in my mind, representing all the moms in this country, that we'd really love for our kids to get back to school, but it's about so much more than that. It's about the well-being and safety and economic prosperity of this country. And having this dream team, along with Kellyanne and Secretary DeVos, Secretary Azar, and our teams here, this country needs to know that we are fighting every single day for every American and to ensure that we can reopen safely and make sure that it's done in the proper way. So thank you, Mr. President.
Thank you, Brooke. Thank you very much. Please.
Mr. President, Mrs. Trump, Mr. Vice President, Mrs. Pence, it's an honor to be here representing Forsyth County Schools in Forsyth County, Georgia. We're about 30 miles north of Atlanta, serve 52,000 students in our school system. We're ready to go. We're going to open our doors on August 6th. We've been planning and preparing all summer. We will have guidelines in place. I'm really proud of our teachers and our students, how well they performed last spring. But as everyone has said this morning, this afternoon, our students need to be back in school, and we will be prepared on August 6th. I will assure you of that.
That's great. That's great. Thank you very much.
Thank you, Mr. President, Mrs. Trump, Mr. Vice President, Mrs. Pence. Mr. President, thank you for your bold leadership and for convening us here today for this vital conversation. It's clear our nation's schools must fully reopen and fully operate this school year. Anything short of that robs students, not to mention taxpayers, of their futures. And their futures represent our nation's future. So it's not a question of if, it's just a question of how. We had a good discussion today on how to ensure schools reopen and education continues in ways that keep students and teachers healthy and safe. Under the President's strong leadership, our economy is roaring back. Our schools must do the same. This is the moment for American educators to rise to meet the needs of every student. Students can't afford to fall further behind. Even before the virus, too many were trapped in schools that don't meet their needs. So this is the time to reopen schools, to rethink school, to be more nimble, more agile, more responsive to students' needs in a 21st century changing world. This moment demands actions, not excuse-making or fear-mongering. We've done whatever it takes before, and as Kellyanne said earlier, and as you've often said, Mr. President, we've dug out the Panama Canal, we've won world wars, we've reduced the Berlin Wall to rubble, and thanks to you, we've defeated ISIS. With grit, determination, and grace, we can do what's right for all students and ensure they are back in school. Thank you.
Thank you very much, Betsy. Appreciate it. Very nice. Please.
Good afternoon. Thank you, Mr. President, First Lady Trump, Vice President Pence, and Second Lady Pence. It's an honor to be here. My name is Nicole Washington. I am a trustee at the Florida Agricultural Mechanical University in Tallahassee, as well as Miami-Dade College in Miami, Florida. As you both well know, our schools didn't close. In many ways, the pandemic accelerated a trajectory that we were already on to use technology to expand services and programs to students. It's not been easy. I actually had the pleasure of teaching a class, a synchronous class this summer at the University of Miami. And I applaud all of the faculty and the staff who have had to pivot on a dime and provide these services to students. Florida A&M is actually going to Oakland. We're going to invite all of our students back in the fall. The board made this decision based on a McKinsey survey that found that only 1/3 of our students would likely stay if we chose to remain remote online for the fall. Students would choose either better online options or options closer to home or more cost-effective measures. And so we are going to reopen. We do want to reopen. I think there are obviously concerns either way. If we remain virtual, we have enrollment concerns, student engagement concerns, as well as budgetary concerns. And then if we open, we have to be very cognizant and vigilant about health and safety, liability concerns, as well as the costs associated with reopening. We're very thankful for the CARES Act additional allocation for testing, tracing, sanitation. That will be a recurring cost going forward. What I would like to close on is the pandemic dispelled the myth that higher education can change on a dime. Our institutions are printing PPE. We've expanded student services virtually and online that we didn't think we could do. Our students are creating apps. And I hope that we encourage those innovations to continue after we return to the new normal, and provide high-quality, just-in-time services to accommodate our students' preferences and their schedules. So thank you.
Thank you very much. Thank you. Please.
Thank you, Mr. President, First Lady, Mr. Vice President, and Mrs. Pence for the honor of being here today. My name is Delaney McDonald, and I'm the student trustee at Middle Tennessee State University. I was actually homeschooled all my life by choice, not because of a pandemic, so I really understand what people have been going through. And I was honored to receive the Buchanan Fellowship at MTSU, which is the highest academic scholarship given to incoming freshmen. I was heavily involved on campus. I actually served as the student body president as well, so I know the extreme importance that the campus environment has on student success. My fellow students across the nation have lost a lot this year, and it is important to all of us to safely return to campus this fall. My university has done an exceptional job of updating the students, of reassuring them that they are tirelessly working for our safe return to campus. And I'm honored to be here today, included in this discussion, and I'm really excited to take back what I learned to my fellow student body. Thank you.
Thank you very much.
Good afternoon, Mr. President, First Lady, Mr. Vice President, Second Lady. I will brag on her. She is an MTSU student. I'm the president of Middle Tennessee State University. We attract the best and the brightest, not only in the state of Tennessee, but from around the United States. Like all the participants here this afternoon, I am honored to be a part of this very important conversation regarding the reopening of schools, colleges, and universities. For the past 20 years, I have served as president of this great institution. We are 37 miles southeast of Nashville. Our university was established in 1911, and we are right now one of the largest undergraduate university in the state of Tennessee. We have grown tremendously over the years, and we are proud to be one of the Princeton Review 2020 300+ best university in the United States of America. We're doing some incredible things there at that university. We have 22,000 students, a very diverse student body, 38% of our freshman class, first generation, and we are proud of that. 40% are low income. Our average ACT score is one of the highest in the state of Tennessee. We are a major comprehensive university. And each year for the state of Tennessee, we produce more degrees than any university, 5,000 degrees each year MTSU produces for the state. Now some highlights of our decision to reopen. We stepped out. We were the very first university in the state of Tennessee to announce that we are going to reopen for the fall. In-person classes. But in reality, Mr. President, we never closed. Because of the nature of our student population, many of our students had nowhere to go in March when a lot of schools closed down. And so we kept our residence halls open. We kept our cafeteria, and we provided the same service, obviously taking consideration the virus. And so we feel that we have the experience of actually operating a university in a pandemic. We regard the health and the safety of our students and our employees as priorities. And it was really interesting as we were making this decision. We have a very active parents' Facebook page, sometimes too active. We have a very active student body Facebook page. And so we surveyed them. We surveyed our parents and our students, and we asked them their feelings about returning, and would they return? The vast majority of both our parents and our students from that survey indicated to us that they would want our university to be opened. So my executive team that made these decisions, including the doctor of our health center, we decided that we were going to put together a plan that would make our parents and our students confident. We can't guarantee anything with regard to this virus, but we felt if we communicate with them and put a mitigation plan together, and I have two of my colleagues here from the state of Tennessee we've met already, and my university had a meeting, was it last week, Commissioner? She brought her staff down. We have put together a very strong mitigation plan that deals with testing, contact tracing, and isolation and quarantine if needed for our students. I want to just give a brief overview of how the CARES money really helped our university, Mr. President. As we look at pivoting from in-person to online and remote, we always had a strong technology operation, but we needed to build a stronger one that would provide the quality education to our university. So we invested $6.9 million. 3.4 of the 6.9 came from the CARES Act. And this investment allowed us to purchase the newest instructional technology to facilitate teaching and learning at the university. What does this mean is that regardless of where a student is, every single class at our university is going to be captured electronically, and it's going to be archived. And students would be able to access those lectures at any time, anywhere, which means if a student gets sick or they have to attend to a sick parent and they can't make it to class, or they are not going to be disadvantaged as a result of this technology. And so we believe that it's in the best interest of our students to open up, to provide that top quality education. We feel that for our students, our university provided 459 laptops, free laptops for our students, 673 internet hotspots, free. For our faculty, 101 laptops, 235 internet hotspots. And so I close with this, that we must understand the demographics, we must understand our community, and indeed we must understand some of the challenges that we are going to face in higher education. And because of the demographics of our student population, we've worked very hard to address the issue of the desperate and disappropriate amount of minorities and people of color and low income that are being affected by this virus. And so we've partnered with one of the sororities, the AKAs, and they've put together an incredible package of information that will be given out to our students as they return. Thank you so much for having us, and we look forward to this conversation. I learned quite a bit today. Thank you, Mr. President.
Well, thank you very much. Thank you very much. Great job, too. So I want to thank everybody, and I want to just say get open in the fall. We want your schools open. It's going to be a much better climate than it is right now. We're on the right side of things, Deborah. I think we can say that. A lot of work has been done. We understand what we're doing very, very well. Again, mortality rate, the lowest anywhere in the world. And we want to get this done, and we want to get our country going again. Economically, we're doing well. We want to do well with the education. I see where Harvard announced that they're closing for the season or for the year. I think it's ridiculous. I think it's an easy way out, and I think they ought to be ashamed of themselves. You want to know the truth. But I noticed that today, and probably others are doing that. That's called the easy way out. I don't know if people are helping them. I guess their endowment's plenty big. They don't have any problem with that. But that's not what we want to do, because it's very important, as so many of the parents and instructors said today. It's so important that the children at this age, especially, that they're together on campus, and that's what we're striving for, and we're going to be very strong on that. We're going to be very, very powerful in that view. We want our schools open in the fall. Tomorrow I'm meeting with the President of Mexico. I say that to the media because it's going to be quite a meeting. He's a good man. He's a friend of mine, and we have a great relationship with Mexico, so we'll be meeting tomorrow. Thank you all very much. Thank you. Thank you very much. Congratulations, everybody.